Allow me, honorable members, to indicate that rules and processes do apply to this hybrid sitting. So before we proceed, I would like to remind delegates of the rules relating to virtual and hybrid meetings and sittings. In particular, sub-rules 21, 22, and 23 of Rule 103, which provides as follows: that a hybrid sitting constitutes a sitting of the National Council of Provinces, that delegates in the hybrid sitting enjoy the same powers and privileges that apply in the sitting of the National Council of Provinces, that for purpose of the quorum, all delegates who are logged onto the virtual platform shall be considered present, that delegates must switch on their videos if they want to speak, that delegates should ensure that the microphones on their gadgets are muted and must always remain muted unless they're permitted to speak. All delegates in the chamber must connect to the virtual platform, as well as insert their cards to register on the chamber system. Delegates who are physically in the chamber must use the floor microphones. All delegates must participate in the discussion through the chat room. In addition, I would like to remind delegates that the interpretation facility is active, that permanent delegates, members of the executive, special delegates, and SALGA representatives on the virtual platform are requested to ensure that the interpretation facility on their gadgets are properly activated to facilitate access to the interpretation services. Permanent delegates, special delegates, SALGA representatives, and members of the executives in the chamber should use the interpretation gadgets in their desks to access the interpretation facilities. I've been informed, honorable members, that there will be no notices of motion or motions without notice. Honorable delegates, before we proceed further, I would like to welcome the Minister of Health. I see the Deputy Minister is also here. All permanent delegates, MECs, and special delegates to the House. So welcome to the House. Honorable delegates, will now proceed to the first order. Consideration of the Division of Revenue Bill B2-2023, 2023, National Assembly Section 76, and report of Select Committee on Appropriation thereon. Announcement, tablings, and committee reports, 4th May 2023, page 209. I now call on Honorable Mahlangu, Chairperson of Select Committee on Appropriations, to present the committee.
Thank you, Honorable Chairperson, Deputy Chairperson of the NCOP, honorable members, ministers, Deputy Minister, MECs, permanent and special delegates, fellow South Africans, good afternoon. Honorable Chairperson, it is always my pleasure to table before this August House a report on the Division of Revenue Bill, that is number B2 of 2023, on behalf of the Select Committee on Appropriations. The committee adopted the report, while the DA, EFF, FF Plus reserved their position. Upon the referral, honorable members and chairperson, the National Treasury briefed the committee together with the Portfolio Committee on Finance on the Division of Revenue Bill on the 8th of March 2023. Honorable Chairperson, Between the 17 and 21 April 2023, permanent delegates briefed all their provinces on the bill. The committee received and considered negotiating mandates on the 26th of April 2023 and final mandates on the 3rd of May 2023. In line with section 72, subsection 1, 2 of the Constitution of the Republic of South Africa and section 9, subsection 5B of the Money Bills Act, the committee facilitated public participation while proceeding with the bill. To this end, the advertisement calling for public submissions were published on the parliamentary website and in print media in all official languages. Honorable Chairperson, despite these efforts, the committee received only one written submission from the Congress of South African Trade Unions, that is COSATU, who also made an oral submission during the meeting of the 22nd of March, 2023. In accordance with section 214, subsection 4 of the Constitution of the Republic and section 10, subsection 4 of the Intergovernmental Fiscal Relations Act, number 97 of 1997, the committee consulted with the FFC and SALGA together with the PBO, that is Parliamentary Budget Office. The committee observed some issues and made the following recommendations, Chairperson. The Minister of Finance should gazette the allocations in the Division of Revenue Bill, the one on the table B2 of 2023, which amounts to 2.03 trillion rands of nationally raised revenue, with a nominal increase of 10.4 billion rands, or 0.5% from the adjusted allocation of 2.02 trillion rands in 2022-23. When gazetting, National Treasury should amend the necessary health conditional grants framework in terms of section 16 to allow funds to be used to address the measles outbreak in the number of provinces. The National Treasury, together with provincial treasuries, should ensure that all provinces develop proper systems to manage the expenditure of their provincial allocations for 2023-24 financial year according to the approved plans and grant frameworks. Honorable members, the National Treasury, together with the Department of COCTA and their counterpart at the provincial level, should quantify the impact of load shedding on municipalities with a view to make additional resources available during the adjustment budget for municipalities to ensure that interruptions of basic services during the electricity blackouts are minimized and criminal elements are addressed. Honorable members, the Parliament should continue to monitor progress in terms of addressing the issues raised above through their committees. Honorable members, the National Treasury, together with the Department of COCTA and their counterpart specifically in KZN and their provincial treasury, should work out a process to ensure that the long overdue compensation of Izinduna is paid out immediately, especially given the fact that the presidential proclamation was issued 10 years ago. Whilst the committee recognizes the impact of budget cuts, it is of the view that for Izinduna not to be compensated as agreed for the past 10 years is highly unacceptable. Honorable Chairperson and members, the National Treasury, together with the Department of Health, provincial health departments, and provincial treasuries, should work out mechanisms to address the issues of medical legal claims. These we've been raising time and again in our committee, which are absorbing some of the provincial health department's budget at an expense of other important medical treatments budgeted for. Honorable members, the National Treasury, together with the Department of Health, should expedite the process of finalizing discussions around the funding of a plan to address maintenance of all health infrastructure backlogs, as recently identified by the department across all provinces. The committee is of the view that maintenance of health infrastructure and facilities has been a challenge for government, and these should be urgently addressed. And Parliament has a responsibility to continue monitoring the progress in terms of addressing the challenge. Honorable members, the Department of Basic Education, together with provincial education departments, should develop a clear plan and monitoring mechanisms to ensure that pit latrines are eradicated in all schools across the country. The committee recognizes the fact that the school infrastructure backlog grants has been merged with the education infrastructure grant. However, implores the education sector to work together to find an urgent solution with specific timeframes to address this problem. Honorable Chairperson, the committee welcomes the finalization of the function shift of ECD from the Department of Social Development to the Department of Basic Education. It is of the view that the 1.6 billion rands added to the ECD grants should also assist to improve remuneration packages for caregivers as part of improving their working conditions. The National Treasury and the Department of Transport, together with provincial treasuries, should ensure that mechanisms are put in place to assist provincial departments to fast-track their project plans to apply for funding through the Provincial Road Maintenance Grant for the building of medulla steel bridges in rural areas, particularly in areas which have been badly affected by floods and where school children still travel long distances without scholar transport. Honorable Chairperson and honorable members, the National Treasury, together with Cabinet and the Gauteng provincial government, should ensure that decisive action is taken to implement the resolution on the e-tolls, where the province will pay 30% of the debt from its own revenue, while the national government will assist with the 70%. The committee believes that this matter is long overdue and needs to be addressed expeditiously by all affected parties. The National Treasury, Honorable Chairperson, together with the Department of Communications and Digital Technologies, should ensure that public service institutions located in rural and townships areas are prioritized in the rollout of broadband to accelerate implementation of connectivity programs for schools and other similar institutions where poor communities across the country will benefit. Honorable members, there is a need to accelerate the pace at which the development of the coastal line is progressing in the Eastern Cape in order to address the impact of the triple challenge and the development of the ocean's economy to benefit the local people. The committee is of the view that this should form part of the district development model. If government is to make the necessary impact in the ground, hence the recommendation. Honorable Chairperson and honorable members, National Treasury should continue to issue regulations, circulars, and guidelines to assist the municipalities as well as to conduct training sessions for municipal officials through the Financial Management Improvement Program in order to improve financial management and compliance in local government, in line with the Auditor General's recommendations. Parliament should once more do their work, continue to monitor the progress in as far as the matter is concerned, or implementation of the recommendation. Honorable Chairperson and members, the National Treasury, together with the Department of Corporate Governance, the South African Local Government Association, SALGA, and the Local Government Equitable Share Trust Team should expedite the process of mapping out the modalities to ensure that the cost of providing basic services in municipalities is accurately reflected in the municipal budget. Parliament, once more, Honorable Chairperson, should continue doing their monitoring in as far as the implementation of this recommendation is concerned. While welcoming the decision by government to streamline the process to prompt respond to disasters and floods based on the KwaZulu-Natal experience, the committee is of the view that the National Treasury needs to ensure that proper consultation is conducted with all stakeholders, including the SALGA, when such changes affect other spheres of government. The committee believes that the budget forum is also an important structure that needs to dedicate enough time to discuss issues reflecting local government. Honorable Chairperson and honorable members, the National Treasury, together with the Department of Transport, provincial treasuries, and cities earmarked for the public transport network grant, should ensure that mechanisms are developed for municipalities to improve expenditure as well as comply fully with the grant framework. Comply fully. Parliament has to make sure that this is being followed, and with the assistance of the legislatures. Honorable Chairperson, the National Treasury, together with the Department of COCTA and SALGA, should continue to develop the necessary interventions to assist the 90% of municipalities in financial distress, and in particular, the 27 that, according to COSATU, are not able to pay salaries for workers and transfer deductions. This is not going to be acceptable, and we need to do our work together with the legislatures. Honorable members and Chairperson, the committee believes that a paper review of local government transfers is needed, especially of the vertical division of revenue, taking into account the increasing number of dysfunctional and financially distressed municipalities across the country, the factors of geography and rurality, and the nature of local development, to ensure proper equitable sharing of nationally raised revenue among the three spheres of government. This should include re-examining the assumptions in the local government white paper of 1998. Their current relevancy needs to be relooked. Honorable Chairperson and honorable members, the committee supports the proposed increased allocations to rural municipalities to deal with historic infrastructure backlogs, and believes that provinces with such backlogs need more investment in rural communities to fight the harsh realities of the triple challenges causing an influx into the big cities. We've heard what was said yesterday here. Honorable Chairperson and honorable members, the committee reiterates its previous recommendations that any shifting or restructuring of conditional grants from direct to indirect grants requires a clear case-by-case analysis instead of using a blanket approach, as well as proper consultation with local government with capacity to implement at the center. Honorable members, a big portion of the increased grant allocation to local government is in the form of indirect grants, meaning that municipalities will not have control over the funds, and this may result in a function shift without due process. While I'm concluding, Honorable Chairperson, National Treasury should consider the SALGA inputs on this matter, as well as the study conducted by the FFC to enhance the process. Let me close by thanking the honorable members for being committed and also being cooperative to avail themselves while they are expected to do so in the awkward hours. Also thanking the support staff, thanking the stakeholders, the media, and the public in general. Thank you very much.
Thank you very much, honorable delegates. And now put the question. The question is that the bill be agreed to. But before proceeding to vote, I shall allow provinces the opportunity to make their own individual party provincial declaration or vote in terms of Rule 86, if they so wish. And just to remind honorable members, maximum time allowed for making a declaration is strictly 3 minutes. Yes, declaration. Okay. Honorable Labuschagne.
The moment the Western Cape rises, Honorable Karim also wants to do a declaration. Get used to it. Honorable Chair, the Division of Revenue Bill of 2023 raises some serious alarm bells. During the committee's discussion, almost every single province again raised concerns with the calculations of the equitable share at both local government level as well as at the provincial level. Chair, we are repeatedly told that Treasury is reviewing these formulas, and we are repeatedly disappointed by the lack of any result. The Budget Forum is clearly not doing what it was intended to do, and the result is increasing dissatisfaction with the way funding is allocated. The cost of delivering basic services has increased dramatically, with bulk electricity and bulk water purchases far exceeding inflation and indeed the annual increases in equitable share. The cost of fuel has also increased dramatically, and this is a major cost component in the delivery of services. The result is a reduction in service levels and an increasingly dissatisfied ratepayer and resident. This makes revenue collection even more difficult than it already is in a time of economic hardships. For this same economic hardship is resulting in more and more residents registering as indigents, increasing the need for equitable share. Chair, a further matter relates to grant funding. Much of the trumpeted increase in funding to provinces and local government is in the form of indirect grants. So really it is not an increase for these spheres, as the national department still control the spending. Furthermore, where the direct grants are increased, it is mostly increasing far below inflation rates, resulting in a real contraction. There does not seem to be any adjustment for population migration. We also see that provinces and municipalities that have proven themselves to be prudent and effective are not rewarded. There is no incentive for good governance, but rather the governments that are well managed seem to be penalized. How else do you explain the fact that the province with the third highest population receives only the fifth highest share of budget? Is it a case of rewarding bad behavior or is it politics? The Western Cape support neither the report nor the bill. Thank you.
Thank you very much. Another declaration, Honorable Karim.
Thank you. I rise on behalf of the KwaZulu-Natal province to say firstly that, you know, typically, Mrs. Labuskaghni, Member Labuskaghni, alarm bells. Member Labuskaghni, sorry. Well, sounding alarm bells and so on. But actually what she says, Chairperson, is exactly what our Chairperson said. I cannot reticulate Mashlangu, adversarial to what's in the report. Absolutely every issue she covered is in some form or another covered by the Chairperson. It's a Chairperson. You know, it might come as ironical even for me to say this, and I understand if that's how you feel and others do. But actually, I do believe we're not the National Assembly and we shouldn't be so adversarial. We are meant to be working around provincial and local government interests, whatever our party political background is. The EFF can mutter and bluster, but it's a lesson for them too. Now, here's an example of what Western Cape is saying, or the DA. I hope the Minister and Deputy Minister are listening to us because they know full well. I know the Deputy Minister was playing a different role, but he's an MEC there and he's a senior member of the PEC. He knows this. We've been raising this thing. Chairperson, you and I are guilty also. When the white paper came, I happened to be chairing local government, March 1998. It's ancient history. But then we were wrong, Chairperson. I'll take responsibility on. We were wrong. We did not sufficiently allocate money to local government. The 1% increase is welcome, but our Chairperson and even the DA says it's not enough, Chairperson. You know that. The municipalities are dysfunctional and in distress. But we keep saying, as Treasury would argue, and they're right, you can't fling money at local government because they often don't use the money productively and effectively. You can't throw money at them. The more they use money effectively and productively, the more we should give it to them, which is why our Chairperson says that it should be a case-by-case basis. You can't just fling the money. If a municipality, small or big, is using the money effectively, Chairperson, they should be given more money. If a municipality is not using the money properly and is being abused, then they're not given the money. But she's right. Everything she says, Ms. Labuskaghni, means you should vote for the report. Why are you not voting for the report? That is bewildering,
I sit down, Wena.
puzzling, and impossible to understand. So let's
Dlamini.
Thank you very much, Chairperson. I'm happy to speak for longer, but you know what? I've heard that what you said before, and I'm bored listening to myself. Thank you very much.
Agree, Chairperson. We're also bored listening to him.
Thank you very much. Thank you very much.
Can we then take it that they not support the bill?
No, none. We shall therefore proceed to voting on the question. And as we proceed voting on the question, let us note that the question is that the bill be agreed to, and now call upon provinces to cast their votes. When called upon, heads of delegation must indicate whether they vote in favor, against, or abstain. We'll vote in alphabetical order. We start with the Eastern Cape.
Eastern Cape iyavuma.
Thank you very much. Free State.
Free State vote in favor, Chairperson.
Free State vote in favor. Gauteng.
Gauteng definitely in favor, Chairperson.
Gauteng in favor. KwaZulu-Natal.
KwaZulu-Natal iyayeseka sihlala report.
Sala Greens. Limpopo.
Iyayeseka.
Limpopo liyayithekga.
Yeah. Limpopo iyayithekga. Support. Mpumalanga. Mpumalanga supports. Northern Cape.
Northern Cape vote in support, Honorable Chairperson.
Northern Cape supports. Northwest.
Northwest support, Honorable Chair.
Northwest support, thank you very much. Honorable Maslangu, you were raising some point.
Chairperson, it's not something serious. I was just drawing your attention that the mic was not on. It needs to be recorded for Mpumalanga,
Oh, okay.
for record sake.
Yeah, Mpumalanga, you
Mpumalanga supports.
support.
And also
Thank you
for
very
feedback,
much. Western Cape. Western Cape.
Western Cape does not support.
Western Cape is against. Voting is now closed. 8 provinces out of 9 have voted in favor. I therefore declare the bill agreed to in accordance with section 65 of the Constitution. Thank you very much. We will now proceed to the second order, policy debate on budget vote 18, health appropriation bill, B3 2023, National Assembly, section 77. We'll follow the speakers list. I now call on the Minister, Honorable Jay Patla, to open the debate.
Thank you very much, Honorable Chairperson, Honorable Amos Masondo, our Deputy Chairperson, Honorable Sylvia Lucas, the Chief Whip of the NCOP, my colleague, Deputy Minister, Dr. Lomo, the Chair of the Select Committee on Education, Health and Social Services, Honorable Nchabeleng, my colleagues, MECs, present here physically, Limpopo and Mpumalanga, and those on the virtual platform, honorable members of the National Council of Provinces. Honorable Chair, let me thank you heartily for the opportunity to present the budget vote for vote 18, Department of Health in this House, the National Council of Provinces, which is a house which is much closer to our citizens by virtue of the direct representation here, as just witnessed a while ago, of our provincial legislatures. Honorable Chairperson, today, the 10th of May, is exactly 29 years since the founding president of the democratic South Africa ascended to the podium at the Union Building to take an oath of office. In that historic occasion, witnessed by a galaxy of world leaders, including the late President Fidel Castro, the late President Muammar Gaddafi, late President of Zambia, also President Kaunda, and a host of other luminaries. President Mandela, at the conclusion of accepting the office and taking the oath, said, I quote, never, never and never again shall it be that this beautiful land will again experience the oppression of one by another and suffer the indignity of being the skunk of the world. The sun shall never set on so glorious a human achievement. Let freedom reign. God bless Africa, close quote. In just a year after assuming office as President of the Republic, he announced to our nation that as from May of 1995, all pregnant women and children under the age of 6 will receive free services at all public health facilities. And a few years later, his government also, through the Minister of Health, decided to abolish all payments of fees at all public services for primary healthcare services. And that is still the case up to today. It is therefore in no way a small way due to President Mandela's intervention that our health outcomes have been improving since that time, especially maternal mortality and under 5 mortality. All these outcomes have improved since that period. Incidentally, honorable members, as we are meeting this afternoon, since Monday the 8th, as a country, we are hosting a conference focusing on these very matters which President Mandela dedicated his government to, focusing on the making sure that mothers and children can get good quality services. We have a conference just across here at the ICC focusing on maternal, newborn and children's health, hosted by a number of organizations led under the auspices of the World Health Organization. Honorable Chairperson, as we present our budget here, another major development is the fact that just 6 days ago, as we all know that we all just recovering from the COVID-19 pandemic, a mere 6 days ago, on the Friday last week, on the 5th, the Director General of the World Health Organization announced that under the auspices of the International Relations Emergency Committee, which had met on the 4th of May, they had taken the decision that based on their assessment that the COVID-19 no more constituted a public health emergency of international concern. And that was based on the evidence available to them, as many honorable members here also will attest to the fact that we are no more under the kind of pressure which this pandemic put on all of us. The mere fact that today we're able to assemble in this house physically, even though others are on hybrid, it's again attesting to the fact that indeed what the WHO is saying is indeed true, that COVID-19 has really abated in terms of as a major public health emergency and as a pandemic. But we want to caution, Chairperson, nevertheless, while we appreciate this development, we want to caution this House and the public at large that this lifting of this declaration does not mean that the COVID-19 is over, as we still record a number of daily infections, although at a much lower level. All that this declaration says is that this virus has now become endemic in our midst. In other words, it's taking the same kind of direction as influenza and other respiratory diseases. But the important thing to note is the fact that for those of us over the age of 50 with the comorbidities, it's still a risk. We can still get seriously ill. And therefore, because of the fact that over this period, we're able to develop vaccines, which have shown to be very effective, we would want to urge honorable members and also members of society at large that it's still very important, especially for those vulnerable, including those on immunosuppressant treatment, to come forward, because we still have a lot of vaccines to get their boosters. On average, every 6 months, we should get our boosters until such time that really this disease has totally abated. I want to take this opportunity, Honorable Chairperson, to thank all of us, including honorable members, for the role which you played, because the mere fact that we have arrived here after all the devastation is because of the fact that all of government, all of society worked together in dealing with this at the height of the pandemic, but also in the rollout of vaccination. So we thank you heartily. And we also want to thank our leader of the state, President Ramaphosa, and his cabinet, and premiers, mayors, and all other, and within the leadership of society as a whole. So our task going forward is to make sure that we protect ourselves, working together with other leaders in Africa and also in the world. Coming back to our budget itself, Honorable Chairperson, the allocation to our sector has been affected also by the consequences of the pandemic and also other subsequent issues. The pandemic didn't only have impact on our health, but on all of society, but also on our economy. And even though there's been leaps and bounds in the performance of the economy, overall, there has been a severe impact on the growth of our economy and therefore revenue collection. And as a result of that, our allocation over this particular financial year and going forward has been declining. And this is indeed a cause for concern. And it's a matter which, as colleagues, honorable members were talking about, the National Treasury, they also, being the custodians of our purse, have acknowledged the fact that health has been underfunded. Their estimation is that it's in a figure, in a range of about 11 billion. We think it's much higher. We estimate just for this financial year, in terms of not taking consideration of inflation, that we have lost about 14 billion and above in terms of the allocation to our sector. Overall, in terms of the total allocation for this year into the National Department, has come down by just over 4 billion rand, much of it which can be attributed to the reduction in vaccine allocation and other matters relating to the COVID. But we also are conscious of the fact that also in terms of allocation in other areas have reduced. Just for the honorable members also to indicate to you that out of this just over 60 billion, just under 90% from the National Department of Health will be allocated as conditional grants and other transfers to provinces. So your job is well cut out in terms of oversight of this 90% of funds. Out of the 60 billion, just over 56 billion will be going to provinces for various functions of the health sector. Notwithstanding these challenges, Honorable Chair, I want to just allude to a number of areas where there has been progress. We would have loved to have more progress, but just to indicate that nevertheless, a lot of progress has been made, and we have plans to make sure that there is further improvement. Human resources is a very key in the area of provision of health services. We can have all the infrastructure, all the equipment, but if we don't have adequate human resources, we will not be able to deliver good quality health services. I'm happy to say to the Honorable House here that there has been significant improvement. If we look at over the last just over 7 years, just to give one particular area as an example, in the area of medical, medical personnel, just to give an example, that in 2015, we would employ just over 1,500 medical interns. But when you look 7 years later, in 2022 and also in January this year, we are now in the region of over 2,600. So from 1,500, over 1,000 interns more over a 7-year period. If you go to medical community service doctors, you find the same increase from a range of about 1,300 to now we're again over 1,000 more, about 2,300 more community service doctors are being employed. I'm sure honorable members also from your provinces, there is still concern that some of our provinces have not even been able to absorb some of the medical officers who qualified after doing their regulatory requirements of community service. Some also who have been on bursaries, but we are addressing this. We're working together with the South African Medical Association and especially the trade union component. We have sat down with them to ask them to give us names of those doctors who have completed all these regulatory services and are not having posts, and we're addressing that one by one. And thanks to our colleagues from all the provinces, they've come forward and provided where there's still vacancies so that this highly required medical officers can be deployed. On the nursing side as well, so a lot of progress has been made. We're rolling out the changes in the training of nurses. Also, there were some challenges in terms of doing post basic diploma going into, because we also need specialists in the nursing section, in the nursing area. You need specialist nurses in the area of theater nurses, midwives, in the surgical area, orthopedics, and all those specialties. There had been some difficulties after the changes in the curriculum, but all these are being addressed by the South African Nursing Council and also the Council on Higher Education. So indeed, we still have challenges in as far as the funding. We want the needs out there are huge, and there's opportunities for further, deployment of more health personnel. But of course, we are constrained by the budget allocation. And I must just say to honorable members that we are also concerned that members will be aware that earlier I think around March, during the course of the public service strike, there was an agreement which was signed in the Public Service Bargaining Council between the Minister of Public Service and the trade unions. Although not all trade unions came to the party, but the majority, about 56% of the unions who are in the public service, accepted an offer which gave an increase of 7.5% overall. But what is concerning for us is the fact that there's indication from Minister of Finance that these funds are going to have to be recouped from ourselves. So they are saying that we're going to have to recoup these funds by savings. Now, what this means that we must reduce headcounts, while on the other hand, from our side, we want to deploy more personnel. So these are matters which we're going to have to interrogate with our colleagues in the National Treasury. In the area of infrastructure, Honorable Chair and members, we're also rolling out various programs and projects to support colleagues in the provinces, because as we all acknowledge that many of our facilities are quite old. Some of them have not been so well maintained, but we also need new facilities. So within our allocation, as the Honorable Chair of the Appropriations was talking here, also within our sector, we do have support through conditional grants. Amongst those is also an infrastructure grant. There is a direct grant which goes directly to provinces. In this regard, for this financial year, we will be sharing amongst all the 9 provinces an amount of 7.2 billion rand, which will go directly to provinces on agreed projects to make sure that they can upgrade the clinics, the community health centers, hospitals, including even some of the specialized hospitals. Over and above that, under the auspices of the National Health Insurance Grant, which is an indirect grant, we will be working together with provinces to support directly, where we will be managing together some of those projects, again, within the category from primary right up to higher levels. The 1.4 billion will be shared amongst all the 9 provinces. And in this regard, I can also just indicate quite firmly that a very long-standing project of giving Limpopo also a central hospital will be starting in a few weeks' time. We are just finalizing, everything has been done, the site has been allocated, the contractor is on the ground. We will be starting construction together with the province of the long-awaited Central Hospital of Limpopo, which will provide a very good intervention. When it's completed by 2028, it will start to alleviate the pressure of a lot of referrals from Limpopo to Gauteng, because a lot of specialties will now be able to be done, including more capacity to train doctors, nurses, and other health professionals. But there are a number of other, all provinces in this regard will be gaining, just in terms of projects which are already on the ground. Honorable Ndogeni will appreciate the fact that in the Eastern Cape, we do have 2 or 3 Zitulele Hospital, Bambisano Hospital. In the Free State, we do have projects, and all over the country, we work with colleagues to support the infrastructure upgrades. I must also indicate, Chairperson, that because of the fact that there's still a lot of inefficiencies, both in terms of speed of delivery, I think when we're discussing local government, this also came up. We also experienced the same. We want to improve the speed of delivery and the quality, and also the cost, because it's still very costly for public infrastructure to be erected as compared to private infrastructure. So we have put a lot of pressure on our technical teams to say this must come to an end. Where it is possible, where we can use just modules, because a lot of these costs are going into planning and design. Whereas we can agree that a small clinic should be of these various designs, a community health center can be this, district hospital, these are the choices of design, you just pick, and then you save on new designs all the time and new project management. So these are some of the things which we are addressing. Honorable Chairperson, primary healthcare is very key in terms of improving our quality of services. So again, I'm sure on various, when we reported to you on various occasions, whether it's our annual report or on our annual performance plan, we have indicated that a very key program in terms of improving primary healthcare services is the whole approach of saying a concept of an ideal clinic. And there are various aspects which you have to meet to be called an ideal clinic. in terms of services, in terms of infrastructure. For instance, you must have a source of water, a generator, and proper signage, but also in terms of how you organize your services, then there's points which you must score. And we're pushing. We did have some bit of regress during the course of the lockdowns and so on, but I'm happy to announce that we're picking up pace again in terms of rolling out, making sure that many of our primary health facilities do achieve the ideal status. We hope in the current year, 200 more PHCs will be also, assisted to achieve the ideal status, which will result at the end of this financial year from 2,000 to 2,400 facilities, which will become ideal. Also, in terms of that, we have to also improve the digital health information in our primary health facilities. A lot of progress has been made. A program which is called the Health Patient Record System has already been rolled out in quite a big majority of our public health facilities, over 3,000 of those, which include clinics, health centers, and also hospitals, have already had the rollout, which will change the amount of time people wait at clinics, because their records will be digital and they will be able to be retrieved much quicker. So we are very close to finalizing this, and this will make a lot of difference. Emergency services are very key. Many people complain about the time it takes when you call an ambulance. So we're working, there's particular standards which all provinces are measured accordingly in terms of the regulations which guide how to make sure that your emergency services are up to scratch. One of the things which we are dealing with, one of the areas which we will be looking at is to make sure that these services, the vehicles which are running these services can be repaired speedily. Honorable Chairperson, as I conclude, just to assure members that the issue which has been raised also in the reports earlier on about medical legal cases, we are working hard with our colleagues to make sure that we can reduce the costs. So in conclusion, Chair, I want to call on members to say the NHI bill is in the National Assembly, is on the way to you. This is our intervention to make sure that we can achieve universal health coverage. And I'm urging all members, I know some parties are hesitant, please be assured that this is a very revolutionary opportunity for us to transform our health system and make sure that all South Africans can be able to acquire good quality services without having had to pay at the side of services. So we're looking forward and we're urging members, when this time comes, please support the NHI. Thank you.
Thank you very much, Honorable Minister. We'll move on to Honorable Nchabele.
Honorable Chair of the NCOP, Ntate Masondo, the Deputy, Ms. Sylvia Lucas, the MEC of Health from Limpopo, my MEC, Dr. Popira Matuba, and the MEC of Health from Mpumalanga, Memanzini, honorable members, all ladies and gentlemen. The budget policy debate on health takes place after we have overcome the health disaster of the coronavirus pandemic, which continues to exist, but is less of a danger now. The capabilities we have developed and the best practices we have gained in this war against COVID-19 should be deepened in improving our health system. The health pandemic also demonstrated the gaps in our health system, and we should continue to respond to the gaps identified. We need to close those gaps. We applaud the health workers and all health sector workers for being servants of the nation who protect our well-being. The progress we have experienced as a nation in addressing various challenges from communicable and non-communicable diseases requires our reflection. We have increased the life expectancy, which has been greatly impacted by HIV and AIDS. The main indicator of the effect of COVID is the fact that life expectancy at birth for males declined from 62.4% in 2020 to 59.3% in 2021, which is a 3.1 year drop from 68.4 in 2020 to 64.6 for females. That is 3.8 years. That is 3 years, 8 months drop. We are confident that these health outcomes will improve as we are beyond the deadly pandemic effect. Our effort to eradicate HIV and AIDS through the current 9595 targets should be continually strengthened to protect the girl child and South Africans in general. HIV prevalence was highest among sexually active women in the age of 25 to 29, then to 45, and then 45 to 49. We must develop programs which respond to these age groups that are most vulnerable. We must also recognize that women who are already on antiretroviral therapy at antenatal first visit increased nationally and in all provinces from 2018 to 2020. At national level, the rate increased from 61.7% in 2018 to 71.5% in 2020. The highest rate of clients already on ART at antenatal visit in 2020 was reported in Western Cape, that is 77.6%, followed by the Free State at 77.4%, and KwaZulu-Natal at 76.6%. This is an important indicator of having a preventative healthcare system. We encourage women to always timely visit health facilities for prenatal care. This is critical in protecting the well-being and health of the unborn baby. We also recognize some of the key areas related to maternal issues of the maternal mortality in facility ratio. The ratio peaked in 2012 at 144.9 deaths per 100,000 births, 100,000 live births, and has since observed a gradual decline to 88.0 deaths per 100,000 live births in 2020. Our health system has also created programs to support children through immunization and vaccination, which protect the health of children. In South Africa's context, the contributor to child mortality due to HIV is as a result of non-compliance to antiretroviral treatment, as opposed to failure to detect the HIV virus. Our immunization rate as a country was estimated at 77% in the year 2018. This progress is as a result of implementation of policies to improve maternal health care, which our health system has made quite some impact on. Another cause of mortality affecting our society is cancer, which was reported in 2019 amongst females, accounted for 51.3%. That is 43,811 of diagnosis of cancers were diagnosed in males, accounting for 48.6%. That is 41,491. The median age at diagnosis of cancer was 59 years for females and 64 years for males. We need to ensure we continually take health checkups to ensure health interventions at early stages. One of the health demanding areas is fatalities, which usually impact health facilities. Approximately 90% of fatalities involved adolescents, categorized as pedestrians and passengers. We must ensure that we do not allow young people under the age of 18 without a learner's license to drive a car without a person with a license, and bar those without licenses to drive a car. The level of health inequality in South Africa is caused by the skewed distribution of health expenditure in South Africa. The National Health Insurance is a policy intervention for equitable distribution of health expenditure, creating a significant backlog in public health care. We welcome the ongoing efforts of the department to strengthen the healthcare system through investing in infrastructure, health equipment, and human resources for health. It is a principled issue for us that fast-tracking the improvement of human resources for healthcare is critical. By keeping an eye on the medium-term execution of the human resources for health plan, South Africa may be assured that it has an adequate number of trained human resources that are evenly distributed through the nation and levels of care.
Let's proceed.
The ANC is convinced that achieving justice and equity in healthcare is important. As a result, we have emphasized the need for national health insurance, a procedure that is still being discussed in Parliament. That means that it's in the NA, it will be referred to us, and I guess it will be done before the end of our term, which will provide the universal healthcare coverage, without giving all South Africans, regardless of their demographic, the same opportunity to obtain high quality healthcare. It is possible to obtain comprehensive justice. The past few years have seen government and various stakeholders robustly deliberate on the different perspectives as it relates to the finalization of the National Health Insurance Bill. It is as such, one of our responsibilities as this administration to provide leadership and direction on the finalization of this process. The point of departure for this being the necessity to advocate for the required reform in the health sector towards the attainment of equitable access to healthcare in this lifetime. The main component of providing healthcare services are integrated health system, health infrastructure, and financing. Due to the expected ability of the National Health Insurance rollout to pool financial resources and distribute health resources fairly, the proposed budget vote prioritizes strengthening primary health care as a first point of reference for access to the health system, working with provincial departments to expand health infrastructure across the nation and planning for the implementation of our national health insurance. We need to build a preventative healthcare system than a reactive healthcare system because it does not reduce the diseases burden of a nation. A preventative healthcare system like that of Cuba improves the well-being of citizens as sickness and mortality rates are reduced, thus having a healthy nation. The improvement of the quality, efficacy, efficiency, and responsiveness of health system is a top objective in the effort to achieve universal health care. Mechanism for developing good governance practices and assessing their effectiveness have been the subject of continued discussion that take into account issues focused on structures and in some cases, health consequences. As it should be a departmental prerogative to ensure that the various governance systems that exist enable the building of a system that is improved and is more accessible to dealing with the complex health challenges and the country is confronted with. What is also critical for the success of the NHI is improving the health system through increasing human resources capacity and infrastructure development and adopting various health technologies to improve healthcare services. We need to assess the technological and digital opportunities to enhance health provision. We are confident that the department will continue to address these areas as they are adequately funded through the Healthcare Facility Revitalization Grant and the National Healthcare Insurance Indirect Grant. In conclusion, Chairperson, as the African National Congress, we support the budget vote to improve the living conditions of children, youth, adults, and old age citizens to live a healthier life for all the people of South Africa. You can see.
No.
They are willing.
Thank you very much, Honorable Chabeleng. As the next speaker, Honorable Bacher, come to the podium. Honorable Lucas will take over the chair.
Masbulele, Honorable Chair. Honorable Chairperson, Honorable Members, Honorable Minister and Deputy Minister, Honorable Members, thank you for the opportunity. Chairperson, it is disappointing to see that a major focus of this year's budget is not the reprioritization of maintenance with the aim of revitalizing the country's health delivery platform, which no doubt would have limited the impact of load shedding on the delivery of health services. This could have included, among other priorities, improving the energy independence of health facilities by installing backup power supplies, such as solar and retrofitting health facilities with energy efficient equipment. With reduction to HIV and AIDS and tertiary services conditional grants and coverage of HIV services relatively high, there is an urgent need to refocus the grant to prioritize increasing ARV enrollment to 7 million people. It also presents an opportunity to increase coverage for non-communicable diseases, such as diabetes, by actively screening people living with HIV who are already active users of the public health system. It is crucial to note that with no increase for the current financial year, it will not allow for the recruitment of additional staff needed in the public health, but will only maintain existing staff levels. We need to refocus the publicly funded health system to progressively expand and provide essential health services and improve the quality and efficiency. Good governance in health is supported by ensuring that decision-making is informed by the best available evidence. With the outbreak of COVID-19, many people saw it as a quick way to enrich themselves. And thus far, we have not had any serious consequences management plan towards these, even though an SIU report was drawn and submitted to the Department on the COVID-19 pandemic procurement irregularities. In January 2023, information emerged of alleged bid rigging in the 486 million lease for the department's new head office. This is but one of many ills that engulfs the department on corruption and irregular expenditures. We need regular updates on how these have been dealt with so as to bestow faith in the good governance of the department. Minister, it is critical and urgent that these individuals are brought to book. Child death is a huge concern that must be dealt with by the Department of Health. Nationally, the reports indicate that a total of 178,445 children died over the past decade in public hospitals throughout the 9 provinces. The causes of death range from pneumonia, diarrhea, and even more concern is the fact that 12,582 died of severe acute malnutrition. An urgent intervention is required in this regard, Minister. We have noted with concern the recent strikes by Nehau in March 2023, affecting health services being provided to the general public. This caused disruptions in the provision of services to the public. We call upon the minister to engage with the union in order to avoid such actions taking place again. Those who do not participate in strike action should be protected at all times from any form of intimidation. Long-term agreements should be explored in order to avoid strike action in our health institutions. There are reports on the current situation at the forensic chemistry laboratories, especially with regards to case backlogs, infrastructure needs, staff vacancies, and low morale. These come from years without being addressed by the ministry. Many health institutions are understaffed, and that creates pressure on those on duty. We need to strengthen human resources to be able to address the shortage of staff, including nurses and doctors, that would assist us to lower the burden and boost the staff morale to deliver best services. Post-COVID-19 pandemic, we need a viable implementation of mental health management, promotion, prevention, treatment, and rehabilitation. We need clear timeframes on various interventions to radically address the improvement of mental health services and delivery. The number of counselors and psychologists providing support to schools through both direct appointments and through district-based support teams are significantly higher in the DA-run Western Cape than any other province in the country. Schools can serve as an important point of contact between children and the provision of mental health services. Schools should therefore be used as an environment through which the mental health of our future generations can be protected and improved. Minister, the sooner urgent issues are dealt with at Charlotte Maxeke Hospital, the better. Matters relating to staffing should be addressed timelessly while reconstruction of the hospital takes its course. Staff equaling the number of beds, namely nurses, doctors, and administration, should be sorted with immediate effect. Oncological treatment should be prioritized to keep up with the demand while reconstruction continues. Another issue is to crack down on criminal syndicates operating in our hospitals, which needs to be uprooted. The crumbling hospitals in GP or in Gauteng, as highlighted by MPL Jack Bloom, are a shocking revelation of the lack of maintenance. But this is the situation almost in all provinces throughout the country. The financial feasibility of implementing the national health insurance is still unclear, and a huge risk to the fiscus in a post-COVID economy that is dealing with recession, load shedding, and unemployment rates. Minister, it has been proven time and time again that the NHI will fail, something your government is oblivious to. But if this failure is to be implemented, that will take place in terms of what would be the medical schemes what would be what medical schemes can and cannot offer members during the transition period and after the undefined date. In conclusion, the pandemic showed that a lack of transparency, good governance, and expert advice can be detrimental to the ministry and to the general population of South Africa. Corrupt procurement contracts for essential services could become the norm if you don't put the department in order. Come 2024, the DA government will be able to address these key challenges that South Africans face. Thank you so much.
Thanks very much, Honorable Member. Order. Honorable members, the next speaker is Honorable M. Eastern Cape, MEC Health, MET.
Honorable Chairperson of the NCOP, Honorable Masondo, Honorable Deputy Chairperson of the Council of Provinces, Honorable Lucas, Honorable Chief Whip of the NCOP, Honorable Mohai, Honorable Minister, Dr. Patla, Honorable Deputy Minister, Dr. Zomo, Ministers and Deputy Ministers present, Chair of the Select Committee on Health and members of the committee, Honorable NCOP members, special delegates representing provinces here today, members of SALCA, fellow MECs, ladies and gentlemen, good afternoon. We welcome the opportunity to deliberate and debate the 2023-2024 budget vote as tabled by Minister Patla yesterday. Let us first thank the National Department of Health under the capable leadership of Dr. Patla and Dr. Dlomo and former Minister Dr. Mkhize for the role it has played in supporting provinces, particularly the Eastern Cape, at the height of the COVID-19 pandemic. We welcome the decision by the World Health Organization to declare the COVID-19 as no longer a global health emergency. We take our hats off to healthcare workers, particularly nurses, whom we will be celebrating on the International Nurses Day on Friday under the theme, Our Nurses, Our Future. We also salute all frontline workers who wave after wave of COVID-19 pushed it back and saved hundreds of thousands of lives. We remain indebted to them. We have noted the budget allocation decline of 4.4 billion rand from 64.5 billion rand in 2022-23 to 60.1 billion rand in 23-24. The budget cuts mean government will have to continue to walk the tightrope and do more with less, working with social partners and donors. Honorable Minister, the Eastern Cape Department of Health is working on a new nursing curriculum. Currently, there are 292 nursing students enrolled at Lilita Nursing College for the 2023 intake. In the Eastern Cape, the first ever class of the new nursing diploma commenced from the 7th of March, 2023. This has successfully taken off in all the colleges, 5 of them, the main campus of Gqeberha, East London, Komani, Mthatha, and Lusikisiki. The major conquest is to obtain accreditation of the one-year higher certificate in nursing, which will ensure we have a guaranteed supply of auxiliary nursing categories. During February 2023, a joint statement of the South African Nursing Council and Council of Higher Education, or for Higher Education, announced a reprieve where nurses armed with legacy qualifications on NQF level 6 can now directly access the postgraduate diplomas in nursing pitched on NQF level 9, thereby granting a temporary waiver for hourly nursing. The college is now organizing itself to develop curriculums for priority postgraduate diplomas. Joint efforts have been taken between Eastern Cape Department of Health, Human Resource Development, and the Nursing Services Directorate, which brings in a crusade of establishing the clinical education training units. These units are an essential component of new nursing education regime. They will ensure a structured platform for clinical education practice for both serving and student nurses. This will go a long way in improving the quality of our nurses whilst continually sharpening the skills of nurses in practice. Lilita College continues to be 100% state-funded tuition for students. This is part of the caring ANC government's effort of opening the doors of learning as committed in the Freedom Charter. We want to also urge parliamentarians to pass the NHI bill so that we will level the playing fields. The NHI is South Africa's chosen route to achieve universal health coverage. The NHI will ensure that everyone, regardless of their station in society, has access to the same quality of care. Only the haves will be against such a progressive policy. Before 1994, quality healthcare services were only for the chosen few based on the color of their skin. That is no longer the case, as the caring government of the ANC, voted by the majority of the people of South Africa, has delivered and continues to deliver quality services to everyone, both in rural and urban areas, black and white. Looking back now, we can boldly say life is better today than it was before 1994. One of the great gains of this people's government is the fact that everyone, not a select few, has a right to quality health and care services. This is guaranteed by our heralded constitution, where Section 27 states that, I quote, everyone has the right to have access to healthcare services, including reproductive health, close quote. Honorable Chair, we partake in this debate inspired by the African proverb, which says, if the lion doesn't tell its story, the hunter will. Dr. DM Dlomo, or DM Dr. Dlomo, was spot on when he said, CCMD creates an alternative access to chronic medication. At the end of February 2023, the province had 395,151 patients on the CCMDD program. These patients are able to collect their chronic medicines either through a fast lane at our health facilities or at one of the 234 non-health facility sites, such as private pharmacies and general practitioners in the province. The department has reached an agreement with the Methodist Church of Southern Africa to open a pickup point at their facility in OR Tambo. 1,449 clients are collecting their medicines from this site. We are targeting to increase the number of pickup points in the next year and also add another 48,778 patients onto the CCMDD program this financial year. We invite other faith community-based organizations, business and traditional leaders to work with us to open up pickup points in the communities. Honorable members, indeed, DM Dlomo and his mineral resources and energy, employment and labor counterparts recently embarked on a successful ex-miners outreach program in the Eastern Cape, following our own that we did last year in October. As a major labor sending area, the Eastern Cape accounts for a big number of those who spent years working in the mines and ensuring that they keep the economy moving. Some left the mines in caskets and coffins. Others developed illness like TB and silicosis because of the poor conditions they worked under, while others went back home without their Provident Fund payouts. Through this ex-miners program, we are ensuring that people will get what is rightfully theirs. Eastern Cape was for many years treated as a labor reserve for the mining industry. We had too many of our people working in the mines. The Eastern Cape Department of Health plays a central role in the implementation of the Eastern Cape Ex-Mine Workers Intervention Program, a program initiated by the Premier Honorable Mabuyane and adopted by the national government. The program is being rolled out across the entire SADC region. Working together with the Eastern Cape Ex-Mine Workers Council as the prime key population, we are taking responsibility for a rollout of occupational health care services in this program. As a caring ANC-led government, Eastern Cape Department of Health's role in the Ex-Mine Workers Intervention Program is primarily about balancing provision of targeted public health care services for the benefit of ex-mine workers and unlocking more than 3 billion rand possible unclaimed social protection benefits for the Eastern Cape in the next 3 years, 2023-24 to 2025-26. The Eastern Cape province has also championed this program and prioritized intervention program to benefit these ex-mine workers, but for all of them in the entire SADC, we are saying as the Eastern Cape, we are at the lead. And our province is doing this by working together with the community of ex-mine workers through South African Mine Workers Association and ex-miners. As I conclude, indeed, the partnership that we have with SA Mine Workers Association and the Eastern Cape Ex-Mine Workers Council and unwavering support of provincial government and national government, we are in the right track to ensure that the TB in the mines and its legacy implications by 2030 is being redressed. Because of time, we cannot say everything, Honorable Chair. However, we have played an instrumental role as the Department of Health in unlocking more than 400 million rand paid by Chiamiso Trust to ex-miners. This is part of more than 1 billion rand already paid in the whole SADC region. Through Premier's Provincial Steering Committee established in partnerships with our department,
Thank you,
provincial and
Member.
nationally.
Your time
We
is
are
over.
honored to say we are turning the tide for the ex-mine workers. We welcome the budget vote as delivered by our Honorable Minister. Thank you very much, Honorable Chair.
Thank you. Thanks, honorable members. Honorable members, the next speaker is Honorable N. Inkosi, ANC.
Thank you very much, Honorable House Chair. Greetings to the Minister, the Deputy Minister, the Mrs. and all honorable members present in the House. Health research plays a very important role in the process of health policy making. Considering that health is a sector that is generally complex, is heavily reliant on scientific research in order to facilitate the kind of quality interventions that are needed in order to improve health outcomes and increase both the quality and length of life in countries. There are global disparities that exist in the health sector, specifically as it relates to general access to healthcare, but also as it relates to the micro complexities that exist at local and household levels. Systematic disparities between the health status of various demographic groups are known as health inequalities. Differences in health status or the distribution of health resources among various population groups that result from socioeconomic circumstances of birth, development, living, working, and aging are known as health inequalities. Significant social and economic consequences are associated with these injustices for both individuals and countries. There is strong evidence that persons' health is significantly influenced by social characteristics such as education, employment status, income level, gender, and ethnicity. There are significant differences in the health status of various social groups in all nations, regardless of whether they are low, middle, or high income. House Chair, in light of this, it is essential for health practitioners at both a clinical and administrative level have the understanding of the broader socio-economic issues that have a bearing on access and the delivery of healthcare services. In the broader context of macroeconomic policy, that of this budget vote debate, specifically, it is necessary to underscore health inputs as outlined in the vote in terms of the different programs of the National Department of Health with various economic variables, including the impact of the cost of living on the quality of health that South Africans have in this conjuncture. The national healthcare insurance thus becomes a significant part of any discussion on health policy, especially as this is related to the affordability of healthcare services. The process of the NHI bill remains an important part of the broader health policy discourse in South Africa. As the South African National Congress, as guided by our commitment to the people of South Africa and achieving health justice, we believe that an important part of research as a tool for policy making includes the specific use of health research to inform strategic health priorities and the intervention thereof. It is as such the correct combination of research and development in health and governmental actions that can potentially address issues that are linked to the health inequality. South Africa still faces quadruple burden of disease that comprises of HIV, maternal, newborn, and child health, non-communicable disease, and violence and injury. Health statistics on child mortality under fifth, and tuberculosis have increased as a result of the impact of COVID-19 on health outcomes, among other variables. According to a rapid review of the impact of COVID-19 of non-communicable disease done by the World Health Organization and the UNDP in SSA, non-communicable disease are anticipated to overtake communicable material, neonatal and nutritional illness as the primary cause of mortality by 2020. Over 70% of deaths worldwide are attributed to non-communicable disease, with a sizable fraction happening in low and middle income nations in South Africa. There is a growing trend in the area of depression and anxiety, with over 25% of our population suffering from depression, and the most affected province being the Northern Cape. There are, of course, other socio-economic factors, such as the impact of load shedding that serve as an impediment to the improvement of health outcomes. This therefore requiring that a much broader approach be undertaken to resolve some of the issues. This including but not limited considering ways to navigate the economic, social, environmental challenges as health determinants. We need to continue to strengthen health system and reduce the number of malpractice and circumstance which lead to medical legal cases. The quality of health facilities is another factor of medical legal cases, whilst having sufficient health human resource capacity is another critical factor. With the current load shedding threats, our health facilities should be able to develop electricity backup power capacity to withstand the power cuts, which can have life-threatening impacts for citizens. House Chair, some of the global threats to health include, but are not limited to HIV, global influenza pandemics, climate change, fragile and vulnerable settings, weak primary healthcare and vaccine hesitancy. This unfolding alongside the rise of the burden of cancer, in particular the challenges related to adequate treatment and care that are associated with this. Millions of people worldwide are now experiencing negative effects from climate change, and more crucially, these effects will only get worse over the course of this century. Science and innovation are critical to continuously improve the capability of health system and to also undertake various innovation of various pharmaceuticals which can help combat various communicable and non-communicable disease. The South African Medical Research Council is one entity makes a significant. A contribution is producing health research which improves health responses to diseases and also impact policy development. The adverse events of climate change have a bearing on the equality of health, as heat, storms, drought, and flooding increases health risk and potentially strains the resources that are available for health. In the same breath, it is crucial to deal with the aspects of poverty, inequality, and unemployment, as these have an impact on health. Generally speaking, poorer and more vulnerable countries are at great risk of ill health. Life expectancy is lower. Mortality rates under 5 are higher. Communicable and non-communicable diseases are generally higher, and the overall well-being of being is compromised. A lot generally needs to be done in order to level the playing field globally, but at the local level. South Africa, as it approaches the end of 6th administration, also needs to be more strategic and forward-thinking in order to create an environment where there is meaningful transformation within the healthcare center, both at clinical and administrative level. In conclusion, Honorable House Chair, strengthening governance system of healthcare is thus priority, and the required effort should be placed across the spheres of government in order to enable signage in policy making and implementation, among other things. Significant roads have been made to enable some changes in the health sector. However, much more must be done to support research and development as critical tools for the development of the sector. We welcome that South Africa regionally has the highest contribution of the allocated GDP on health research. However, much more still needs to be done in order to ensure that we remain ahead of providing solutions to some of the developmental challenges that face the country. As the ANC or as the African National Congress, we therefore support budget vote 19. Thank you very much, Chairperson.
Thanks very much, Honorable Member. Honorable members, before I call the Gauteng MEC of Health, Honorable NCOP Plenary, I want to make sure that you are on visual because I've been advised that you were here, but you got the agent call that calls you back to Gauteng. So I want to make sure that you are on visual. Honorable Nomantu Nkomo Ralekoko, Gauteng, MEC.
Good afternoon, Madam Chair. I am available now. Premier released me to come and debate. I'm on virtual now. Thank you, ma'am. Thank you. Let me greet you, Honorable Chair, and greet the Chairperson of the NCOP. Let me greet Honorable Minister, Dr. Joe Pasha. Let me greet the Deputy Minister, Dr. Smongseni Dlomo. Let me greet the ministers and deputy ministers that are present in the House. Let me greet all the honorable members of the House of the NCOP, colleagues from other provinces who are the MECs and the senior managers, distinguished guests, ladies and gentlemen. Honorable Chair of the NCOP, it is an honor for me to present to this House the contributions that Gauteng Health is making towards improving healthcare services in the country. Health matters and the incumbent challenges of the health faced by society is the main domain of governments. It is the collective responsibility of both society and the state to preserve life. However, governments are expected to conduct health planning and to champion progressive health programs that must serve the broader interest of the citizens. Because of the province's working population size, cosmopolitan nature, and demographic profile, the province's capability to lifestyle or diseases, which may burden our health infrastructure, and as a result, it affects the economically active population, and by extension, the productivity in Africa's fourth largest economy, which is healthcare, and indeed, healthcare is critical because of those issues that I've raised. As a result, the quality of healthcare services that are accessible and welcoming remain essential in the universal healthcare coverage goal that we all strive for. In this regard, the Gauteng Department of Health has continued to implement the ideal clinic program across all on its primary healthcare facilities and has not only managed to increase the number of clinics that were found to be ideal facilities by 4.4%, it has also managed to maintain the performance on ideal facilities above 90% for 2 financial years in a row. For the current year, improvements were also observed amongst facilities that previously did not obtain the status due to failure to attain a non-negotiables and vital elements. Access to care has also increased post-COVID-19 pandemic restrictions. We are also able to promote healthcare services to over 90 million clients, a 6% increase in patients' visits compared to the previous year, whilst our hospitals outpatient department saw over 5 million patient visits. Honorable members, the Deputy Minister yesterday in the National Assembly spoke about the patients accessing their chronic medication via centralized chronic medicine dispensing program. There is a great deal of work that we have done as a province to improve access to medicine by decongesting our clinics and by encouraging more patients to enroll in the program to collect their medication close to where they reside. So far, we've increased access to medications by over 96,422 customers through the centralized chronic medicine dispensing program, now known as Double Up Meds, and it's bringing the total enrollment to 1,196,422 clients. In the current financial year, we intend to boost enrollment over 1.2 million to our people. Oncology services, again, have been a challenge with the rising demand from various treatment of cancer patients. The department has, in order to respond to this need, commenced with the construction of bunkers at 2 other central hospitals, which is Chris Hani Baragwanath Academic Hospital and Dr. George Mukhari Academic Hospital. In the meantime, whilst bunkers are being constructed, Steve Biko Academic Hospital has provided mobile brachytherapy services to cancer patients in the interim. Honorable members, in order to improve accessibility of healthcare services, we are currently operating 38 of community healthcare centers on a 24-hour basis in the province. We are providing a range of services, including maternity care services. The department remains committed to improving our response to various emergencies. As such, we have boosted our emergency medical services fleet by procuring ill-terrain vehicles from each of the districts, and this includes 30 ICU maternity ambulances. In addition, we have also launched the first responder training that is offered by Gauteng Department of Health's Libone College of Emergency Care. This training is meant to empower participants in the townships, in the informal settlements, in the hostel communities, and to be able to respond to commonly encountered emergencies such as trauma, accidents, medical and suicide incidents, while awaiting emergency response teams. To respond to children with specific needs, we are establishing centers of excellence to ensure a comprehensive and cohesive system for children with special needs in order to obtain better healthcare outcomes. These centers of excellence are one-stop shop for children with autism, Down syndrome, and cerebral palsy, amongst others. This is to ensure effective care and treatment for children with special needs. These centers offer a multidisciplinary approach provided by a multitude of role players: case management, physiotherapy, occupational therapy, dietetic speech and audiology, psychology, social worker, pharmacy, medical officers, and various medical specialists, including pediatricians, neurologists, and orthopedic surgeons, including neurosurgeons. In addition, we have established support groups with health facilities across the province. Currently, there are 22 support groups for children with special needs, including cerebral palsy, and our intention is to increase them. In Tshwane, these centers of excellence include Stanza Bopape, Khabo, and yesterday's community healthcare centers. In Lodiam, we have it. In Soshanguve and Kalinen, CHCs are also in the process of establishing their centers of excellence. Parents in Ekurhuleni can access these services at Nokutulangwenya CHC, in Tsakane Therapeutic Center, Davidton Main Clinic, Mary Moodley Clinic, Itireleng Clinic, Crystal Park Clinic, Polar Park Clinic, and Bethakowa Therapeutic Center. Whereas in the Johannesburg district, parents can get the services at Hillbrook Clinic, Discoveries, Alexander, Shiawela Clinic, and Stratford CHCs, as well as Mufulo and Zola clinics. The team is in the process of establishing a center of excellence at Lenasia South District Hospital. In the West Rand, parents can visit Beckersdale and Kutsong Main Clinic, while in Citibank District, the services can be accessed at Johan Hayes CHC. Honorable Chair, one of the issues which was raised in yesterday's budget vote debate relates to mental health. Investment in suitable and evidence-based treatment remains extremely limited, and many people experiencing mental health conditions where they suffer great human rights violations, stigma, and persistent discrimination. COVID-19 has intensified the risk factors commonly associated with poor mental health, which is attributed to financial insecurity, unemployment, anxiety, and depression, amongst others. This has exacerbated cases of mental health challenges in our society. As Gauteng Health, we have been in an ongoing process directing our attention to provision of efficient mental health services through giving priority and maximizing access to mental health facilities. For the current financial year, the department has set aside 124 million for mental health care beds expansion. Some of the facilities are going to benefit include include Bethakowa, Pulusong Hospital, Tembisa Hospital, and Yusuf Dad hospitals. The department welcomes the allocated conditional grant funding by the National Department amounting to 13 billion, which is being used, amongst other things, for the provision of tertiary services, HIV and AIDS, and training of health professionals. So, honorable members, as government, we must continue to appropriately resource, to transform, improve, and sustain the access. As I conclude, Madam. Thank you, Madam. As I conclude, we need to sustain the access of quality healthcare provision for all citizens of Gauteng and the entire South Africa. I thank you, Madam Chair.
Thanks very much, Honorable Member. Honorable members, the next speaker is Honorable S.A. Lutuli, EFF.
Mphathiswa sihlalo, umuntu abingelele nababukele emakhaya. Chairperson, the Economic Freedom Fighters rejects budget vote 18 on health. We reject the budget of the department, which is known only for its widespread inefficiency, staff shortage, differences in skill set between rural and urban areas, and poor patient management. The delivery of equal and quality healthcare is a constitutional obligation in South Africa. But this department faces numerous challenges at all levels and fails the very patient which is designed to help. On daily basis, pensioners, pregnant women, women in labor, and terminal ill stand in queues outside clinics as early as 4 a.m., desperately in need of medical attention. Yet this minister operates health facilities according to office hours and denies the opening of health facilities, clinics for 24 hours and 7 days a week. At national level, the Department of Health is characterized by mismanagement of finances for the healthcare system. And at provincial level, provincial health department are ridden with mispractice claims leveled against them. Chairperson, health facilities are overcrowded with too many patients and not enough facilities. Public hospitals are suffering from shortage of finances, with health facilities begging to pay staff. The problem that seems to be plagued in our healthcare system and other sphere of government is corruption. As although capital is injected into the healthcare system, it is being lost by wasteful and fruitless expenditure. The financial loss caused by corruption is significant. Putting more money into the system will therefore be pointless exercise until leaking of finances is addressed. Chairperson, year in and year out, large proportion of money go unaccounted for, which means that patients are not receiving the full amount of resources allocated to them. This leads to shortage of medicines and leads to an inability to maintain infrastructure. Chairperson, ambulances in KwaZulu-Natal and Limpopo province are not working. If they are, the service is very poor. In the Eastern Cape, Gauteng and Northwest, there have been numerous reports on shortage of beds, poor medicine supply, or a total shortage thereof. Long queues and rude staff that humiliates and condemns our people to indignity. Last year, Chairperson, the minister watched and said nothing as the Limpopo Health MEC, Dr. Ramathuba, made xenophobic remarks about immigrants allegedly overcrowding the public health. Made xenophobic remarks about immigrants allegedly overcrowding the public sector system. This, despite there being no scientific evidence suggesting that foreign nationals cause an undue burden on the public healthcare system. African nationals are accused and used as scapegoats for poor health system. There also still exists a major divide between the kind of healthcare that our people receive. The major difference between those who belong to medical aid scheme can afford to attend private facilities, while those who cannot afford medical aid use public sector. The healthcare system is characterized by social exclusion, divided by those who can and those who cannot afford. Chairperson, services in our public health institutions are failing to meet basic standards of care. There exists long waiting time before patients can see doctors and nurses. Patients still have to wait for several hours for average before they see healthcare professionals. Chairperson, public healthcare facilities are overburdened and overcrowded, creating poor attitude of staff at the hospitals. There also exists an unequal distribution of health professionals between the private and public sector, as well as an unequal distribution of public sector professionals among provinces, ikakhulukazi emakhaya. Even if more funding is added, money is still lost unnecessary to irregular expenditure. For example, the healthcare system in South Africa is ruined and in serious need of repair. It is characterized by policy inconsistency and political indecisiveness. It is characterized by poor infrastructure, shortage of medical professionals, corruption, and unskilled management. Our people essentially go to public hospitals to die instead of getting health care. South Africa should know that the only solution they have is to remove the corrupt ANC government from power. Our power, I still have time. South Africa should know that the only solution they have, and this is the only solution, is to remove the corrupt ANC government from power. Our hope lies in a new government that respects the constitutional rights of our people to life. For those reasons, Chairperson, we reject this vote. Thank you.
Thanks very much, Honorable Member. Order, Honorable Members. The next speaker is Honorable S. Lomo, Deputy Minister of Health.
Honorable, I hope it is Honorable
Luthuli.
Luthuli is saying she has left minutes for me. Thank you very much, Honorable Luthuli, for that. We would like to actually thank the invitation to come and present this budget. And I really want to thank those honorable members, Chairperson, who have already supported this budget and those who are still coming to support this budget. Because supporting a budget like this is saying, Minister Pasha, go on despite the challenges that you face to welcome pregnant mothers in our country to come and deliver babies. You are saying for those who are also drinking and driving on the road, when they land into our hospitals, fix their bones and get to moving. Those babies that are delivered and needs to support. So if you don't support this budget, I don't know what you are saying. I really don't. And South Africans must remember those parties that come here and say they don't support the budget. To the honorable members, the chairperson and deputy chairperson of this house, my colleague MECs who are here supporting the minister who is here with all of us, and we are having our Director General also with our senior managers also supporting us in this house. We are very delighted to be here. I want to start by saying one would like to, as we are approaching the 12th of May, the International Nurses Day, pay tribute and acknowledge the great work of selfless and contribution of our nurses in the country we call 20 Nightingales, who left their homes in 1961 at the call of President O.R. Tambo, who also had been called by President Julius Nyerere when Tanganyika, now Tanzania, lost those white nurses who could not stay and work and support an independent Tanzania under a black government. Those were white nurses who were coming in from UK and they left. So President O.R. Tambo mobilized these 20 Nightingales who left. And today we want to honor in particular and thank the government of Eastern Cape for having a special provincial official funeral of Mama Kolega Rosemont Tunyiswa, a funeral that was held on the 22nd of April and laid to rest in Gqeberha. We only have 2 remaining of these 20 nightingales is Mama Nosipho Shumpela from the Eastern Cape and Mama Cecilia Kuzwayo in KwaZulu-Natal. This morning, I joined the Minister of Sport, Arts and Culture, Minister Zizi Kodwa, with the MEC of the MEC of Western Cape and the Deputy Mayor there for what we call a move for health, which is celebrated every year in the 10th of May, initiated by the World Health Organization. It's a very important activity. It focuses us on having some physical activity to deal with the non-communicable diseases. It must be for all of us to move for health every day. Now, this is actually complemented by the speech of Honorable Chabeleng, Honorable Bach, Honorable Nkosi, who also are focusing and supporting us that as a department, we are going to continue with with the National Strategic Plan for Prevention and Control of Non-Communicable Diseases. We are going to be on a campaign on this program because it is really almost becoming a pandemic in our country. We are taking an approach similar to that on HIV and AIDS, TB of 90-90-90, but here we are taking a strategy of a 90-60-50. And I want to say all of us here in this room, 90% of us should at least know whether we do or do not have high blood pressure, whether we do or do not have high blood sugar. Following that, those, at least 60% of those must have really gone to some intervention of that, whether it's decreasing the weight for those who are obese, also getting into a program of eating properly, doing a physical activity, or then start medication if so needed. The last 50 is that 50% of those on this program, that program must work for them. You must be able to control the illness. Otherwise, we're not going very far as a country in terms of these processes. We have set ourselves as a target as a country to annually screen about 25 million of our people on these conditions. Now, we have actually screened last year 32 million for high blood pressure and 31 million. And we thank all the provinces for really taking and heeding on these processes. We just need to strengthen that and do much more by actually introducing this part, which is called an HbA1c. It's a very important process. I was taught by my DG on this process, where you actually are able to check the sugar levels, not just only today or yesterday. It checks you for a period, and therefore we are able to control on this process. I'm not going to talk much on this program that MEC Met and MEC Nkomorale, who have spoken very well on it, CCMDD. That program is very important for us, where we are saying citizens of our country, yes, we still have a challenge in various clinics in terms of having enough staffing. So you who have got treatment to collect, we will send it to your house every other month, but you come to our clinics only 4 times a year. So we decrease waiting times, we send it to the churches, to the mosques, to the crèches around you, and they collect it. It actually also improves the adherence to treatment. Well, people are not going to say, I didn't go and didn't get treatment because I didn't have money to go to the clinic. We now give it to them, treatment to them. That's what we are saying as an ANC, it works. And I don't know what Honorable Tulu was saying, that they don't see these processes happening. Now, so, because ANC is going to continue delivering for our people. Now, we want to say again, we have listened to young people in our facility saying, Dr. Pasha, we are not very happy with the treatment that we receive in some of your clinics. There's an attitude, we don't listen. Therefore, we started a program called Adolescent and Youth Friendly Services, and therefore creating youth zones where this and that clinic already, when you go to a provinces, honorable members, look for clinics that have got a sticker saying youth zones. So in those clinics, we have got a nurse who is actually very cordial and not judgmental to a young 17-year-old who says, I am here, I want to finish my matric, I don't want to fall pregnant, please help me. We don't have to send them to say, go and call your grandmother before I give you. We need to support them and get them to, because they would then have a user-friendly service within our facilities. We owe it to our young people. Minister, we have been approached by some of the private schools. I think they like what we are doing because all our young girls between 9 years and 14 years, we give them HPV vaccine, which is actually helping us so that later on in life, they do not get cancer of the cervix. Now, this program is actually missing out some of the children who probably are in private schools and they benefit. But because this will be paid for by their medical aid, parents want their children also to benefit. We as a government will support them in those processes. This government has done this part by identifying about 2.1 million learners on grade R and grade R and grade 1 to be screened for through this school program. Please let us get it right. The school health program is not happening only in the Western Cape, it's happening all over the country. So this data that this is about Western Cape is not there, really is not. We have statistics. No, we have statistics nationally that tells us that all of the provinces are really championing the school health program, and we can give you evidence of that. There is a very innovative program done by the Department of Health in partnership with Home Affairs. We have 1,445 health facilities in the country where we now have Home Affairs clinics, so the Home Affairs offices within hospitals. We now call it, our hospitals are offering you a B&B. Not bread and breakfast this time, a baby and a birth certificate. Now you go to our facilities. So our hospitals through the leadership of Dr. Phahla is offering now what? A B&B. And we want to accelerate this. We also hear that DG is on the plans to improve and also increase that we also get death certificates from facilities. Can you imagine a mother coming in to deliver and going home with a baby and a birth certificate? It's actually very innovative, coming in from no other government except the ANC government. And therefore, we actually commend that and we like that very much. Now, just to add on what the minister said.
Just to conclude, Honorable Minister.
So early to conclude. Oh, okay.
Yeah,
right. As I conclude, I want to say I would invite you on the 7th of March, 7th of July, to come and have a graduation ceremony of the 410 students who have completed in Cuba. Unfortunately, this program is taking place in the Western Cape, UCT, because they are part of them training our students, but there won't be a single student there who come from Bekweni, who come from Kailisha, Kukuletu, Nyanga, or Michel's Plain, because for some reason, Honorable Lapaskakni, while you claim to love Nelson Mandela so much, we don't know when you hate the program that he initiated of having a partnership with Cuba and sending students there. Because we started sending students there because universities were not having spaces to do that. Thank you.
Thank you very much. Thank you very much, Honorable Zomo. The next will be the MEC of Limpopo, the very famous Honorable PC Ramatu. Honorable Chairperson, Honorable Minister and Deputy Minister, honorable members of this House, MECs who are here, and also those who have joined virtually. My wish is to start by congratulating the Minister of Health, Dr. Joe Phahla, for the incredible budget vote speech that you presented before the National Assembly yesterday. Though succinct, the speech was detailed enough to capture the essence of the ANC-led government, what the ANC-led government will do in the current MTF to respond to the aspiration of the entire South Africans insofar as the healthcare is concerned. I therefore wish on behalf of the people of Limpopo to join millions of South Africans, not the minority, in welcoming the speech. Honorable Chair, there is no doubt that this has been the most challenging term for the healthcare sector. This will go down the annal of history as an administration that was largely disrupted by COVID. COVID-19 has exposed our weaknesses and failures, both public and private. As a province, Limpopo, where only 8% of the people are covered by medical aid, private hospitals could not provide beds for them. Therefore, no one must tell us that don't fix what is not broken. Private healthcare could not even cater
for those that pays for medical aid every day. Equally with us in the public sector, we have seen that a number of us has not been focusing on our health. Deputy Minister, you're quite right that we must join you in your activity today of preventative healthcare, where on a daily basis, 30 minutes, honorable members, walk for 5 days a week. It's enough to maintain your blood pressure, your blood sugar, your cholesterol, and make sure you go and check your health status, because we have seen that if we pick up your diseases early, we are able to deal with it. That even goes to cancer. But if you wait until you are complicated, you are going to blame our hospitals and say, well, rest, congruent to what the minister's assertion that primary healthcare, open quote, primary healthcare is at the center of improving access to and quality healthcare services, close quote. As a province, we are remodeling our clinics and healthcare services to be dependable and attractive first points of entry for those in need of primary healthcare. Consequently, we have declared this year the year ahead of the year of primary healthcare. This declaration is neither as a mere slogan, Chairperson, nor a rhetoric. It is a living commitment to build on our existing capacity to prevent disease, prolong life, and promote healthy lifestyle amongst the people of Limpopo. At the heart of our rejuvenated approach to primary health care, honorable members from the EFF, is the provision of the 24-hour service at most of our primary health care. To date, all our 26 healthcare centers are operating 24 hours. By the 1st of April, already 2023, 43 more clinics, which were not running 24 hours, are activated to run 24 hours. Just to give you an example, if you go to Capricorn District, because you will say I'm talking about numbers, go and visit Eiselberg Clinic, Indermark, Semenya, Skwansekasek, or Rachaj. If you go to Skukune, go and visit Matsepe, Twaying, Makeps, Flay, Selala, and Nkwana. These are just a few. You go to Vembe, you visit Chiombo, Masisi, Minga, Mabambe, Madimbo. You go to Bakenberg, you are going to Waterberg, you'll find Bakenberg, Parameng, Pinas Refir, and many others. You go to Mupani, you'll find Benfam, Tomo, Kakala, Shotong Den. But I must also, honorable members, raise this, that in Mupani, 2 more clinics, 3 more clinics, which is Ralela, Mukhoboya, and Madumani, should have started 24 hours, but they could not. Why? In Madumani, we appointed more professional nurses to support so that they can run 24 hours. The poor nurse, as she was coming from home to the clinic, she was raped, left for death. She managed to crawl to the nearest household where an ambulance was called. Fortunately, we saved her life. Do you think, honorable members, are still allocated to that clinic? No. Then it means this clinic will have to wait. Hence, honorable members, you must help us to talk to the communities that if they don't protect healthcare workers, these services that they so much need are not going to happen. Today, as we speak, there's a man who is appearing in court who entered the consulting room and demanded to be seen in front of another patient because he needed a sick note. And when the nurse explained the process, he started physically assaulting the nurse. So these are some of the issues which are beyond our control, even if we bring security, that we are asking you to assist and support us on that. Honorable Chairperson, an effective and responsive healthcare system, it's a system that will demonstrate by having a reliable emergency medical services. And as a province, we must indicate to you that we have prioritized. It is for the first time in the history since 1994 that we've put aside through our savings, by the way, no extra money. Treasury allocated us 50 million. We then reprioritize another 500 million. So 500 ambulances are going to be procured in this financial year for the people of Limpopo. And most of them will be allocated in the rural areas. Again, honorable members, we must appreciate that COVID-19 has made us to start doing things differently, become innovative, and also come up with ways, because it affected other services, especially the surgical backlog. That's why we came up with what we called rural healthcare matters. Today, it's one of the unique and successful, which is sustainable, wherein we take specialists to rural hospitals. As we speak now, we have got maxillofacial surgeons that are in Mubane, C and Patudi, operating 21 patients to make sure that they do. To date, more than 6,350 patients have survived, but have been operated. Unfortunately, this project, which was meant to address the backlog for the people of South Africa, it's getting hijacked by people who have money but could not get those services in their own country because they buy space from some of our corrupt officials in government, and we must admit to that. And it means even the patients themselves are participating in corruption, and there's nothing wrong with us calling them to order to say you cannot come, because we're not talking about a woman coming to give birth from who is undocumented. We're talking about somebody who comes and jump a queue for breast plastic surgery. That is wrong. That project is meant for people of South Africa who can't afford. Many of you will say that because if you want those operations to be done on you, you will easily go to private hospital. But this is not on. It is wrong, honorable members, and it must be corrected. And everybody who's involved, who's participating in destroying this Nobel program, which is done by volunteering specialists who are not even coming from Limpopo. Some of them are surgeons who are all over the country. So we will defend this project because it's the only hope for many rural patients in our province. Honorable members, again, COVID-19 has taught us that in order to accelerate service delivery in rural areas, we must be able to use technology. Minister of Health, just last year, was able to launch the last CT scan at the Sekhukhune district. There's no radiology in St. Rita's Hospital. You ask yourself, how do we manage to operate through our technology and a PEC system? A radiology can be staying in Japan or anywhere, but will be able to interpret and help the surgeons in Sekhukhune to operate. It didn't only go there and end there. Minister also launched mammogram. All our districts have got this mammogram, wherein women are able to be screened for breast cancer. Not only those who are in the metros will access mammogram, even a woman in Sekhukhune district, even a woman in Ibembe from Chilidzini can a mammogram access to that through technology in a rural province, which is very poor, but we're able to win that. So, Honorable Speaker, we are continuously looking at equipment. Our MRI, we've just ordered two new MRIs. We've just ordered another linear accelerators, and we're expecting them to be delivered before the end of this financial year. Let me welcome you, Minister, the infrastructure grant that you continuously give us and give you feedback. Honorable members always challenges us of non-expenditure. The CFO is here from the National Department of Health. He can attest to you that in Limpopo, our expenditure on infrastructure grant is 100%, including even other grants. We don't return money to Treasury in Limpopo. What did this money do, Minister? You go to Petersburg Hospital, where we didn't have enough ICU beds. We have now renovated one old dilapidated ward, and we've built in a brand new ICU bed. You go to Mudimule, FH Odendal, there's a state-of-art maternal and child health care. So, Minister, the long-awaited Limpopo Academic Hospital, this will be the first that we are going to have after we have had a medical school since 1994. Limpopo is the first one to have a medical school. In 2021, we had the first group graduating, the second group, the prophet of doom in this house when I came in my first year. When I say we are establishing a medical school in Limpopo, they say it won't happen over their dead body. I'm worried they are still alive because the doctors have graduated in Limpopo and they will continue to graduate. We are not ending there. We're
Honorable
saying, Minister,
MEC.
with your hospital that you are giving us, we have started the processes because it will need professional. We are going to do organ transplant.
Round
How
up,
will we
Honorable
achieve
MEC,
that?
please.
We are taking our doctors to go to other hospitals to train as pediatric surgeon, as urogyne, as pediatric cardiologist. We will have all that to win. Mental health minister, we cannot, Honorable Chair, be told by the DA that
Thank you,
Western
Honorable
Cape,
MEC.
it's run well. I don't
Thank
have
you,
time.
Honorable MEC.
Ladies and gentlemen.
Order. Order. Right. Order. Honorable members. The order. Honorable members. The Honorable Chair of the NCOP, Ntate Masondo, indicated when we started that if we have the speaker on the floor and we are on the virtual platform, you must remain muted. Don't unmute yourself because we can even recognize who's disturbing when we have a speaker on the floor. I'm appealing, please. Let us not make that mistake again. Now I invite the Honorable Dubrain. Honorable Dubrain.
Thank you, House Chief. Agbare voorsitter, jaar na jaar word die jaarlikse prestasieplanne van hierdie departement en sy entiteite bespreek en jaar na jaar is daar geen of slegs vae antwoorde gegee oor die probleme in die gesondheidssektor wat die lewens van pasiënte in staatshospitale bedreig. Ons sit met 'n verminderde begroting van 64,6 miljard in 2022-23 na 60,1 miljard in die 23-24 finansiële jaar. En dit na die minister in 'n antwoord op 'n geskrewe vraag in Maart vanjaar bevestig het dat daar steeds 5100 vakante poste in die Vrystaat is en dat dit minstens R200 miljoen gaan kos om hierdie poste te vul. Die toestand van gesondheidsorg in die Vrystaat en in die res van die land is haaglik om die minste te sê. En dit is as gevolg van 'n tekort aan dokters, verpleegers en algemene werkers, maar die begroting word steeds verlaag. Agbare voorsitter, dit spreek nie van 'n departement en 'n regering wat die welstand van sy mense op die hart dra nie. Pasiënte kla op 'n daaglikse basis vanuit staatshospitale dat hulle vir weke en selfs maande moet lê en wag vir operasies as gevolg van 'n tekort aan beddens, medikasie en dokters. En pasiënte buite hospitale kan nie opgeneem word en noodsaaklike behandeling ontvang weens hierdie selfde redes nie. Voorsitter, ons kry hierdie klagtes op 'n daaglikse basis vanuit elke provinsie in die land. Die Oos-Kaap sit tans met 'n groot tekort aan kroniese medikasie as gevolg van wanbetaling aan verskaffers. In die Vrystaat lê pasiënte en wag vir ortopediese behandeling vir maande aaneen. Die feit dat 178,000 kinders in die laaste dekade in staatshospitale oorlede is skokkend en onaanvaarbaar om die minste te sê, agbare voorsitter. Die VF+ het die afgelope paar maande meer as 400 klagtes ontvang vanaf pasiënte in staatshospitale van reg oor die land oor die onmenslike behandeling wat hulle ontvang het in hierdie staatshospitale. Die gruwelike skendings van menseregte wat ons moes aanhoor oor hoe hulle behandel is en wat gelei het tot verskeie sterftes is onbeskryflik. Dit, voorsitter, is sekerlik nie 'n getuigskrif van 'n regering wat omsien na sy burgers se welstand nie. Terwyl die gesondheidsorg in elke provinsie ten gronde gaan, as gevolg van finansiële tekortkominge, word daar nou 1,5 miljard rand toegewys aan die nasionale gesondheidsversekering. Selfs met die onsekerheid van wat hierdie model die belastingbetalers van kos en met geen finansieringsmodel nog beskikbaar nie. Die afgelope paar maande het ons onwettige stakings van gesondheidswerkers in die openbare sektor beleef, wat gelei het tot ernstige diensleweringsbeperkings in ons gesondheidsfasiliteite. Ons het ervaar hoe ambulanse verhinder is om openbare hospitale binne te gaan met pasiënte wat dringende mediese aandag benodig het. In die haglike omstandighede waaronder hierdie gesondheidswerkers op 'n daaglikse basis hulle werk moet verrig, het gelei tot hierdie stakings. En dit was 'n duidelike boodskap aan die regering en die minister van Gesondheid om hierdie omstandighede te verander. Anders, voorsitter, as ek bevrees gaan ons nog meer stakings in hierdie bedryf sien. Dit stel die pasiënte se lewens in 'n ernstige gevaar en die regering moet daarvoor verantwoordelik gehou word. Voorsitter, Die regerende party gaan vandag nog baie te sê oor die oorsake van die gesondheidsprobleme in Suid-Afrika. En ons weet hulle gaan praat oor die verlede en hulle gaan ook geen eienaarskap en verantwoordelikheid vat vir hulle eie mislukkings nie. En nog 'n termyn onder ANC bewind sal katastrofies wees vir gesondheidsorg in Suid-Afrika. Suid-Afrika is siek, agbare voorsitter, en die ANC regering is die virus wat hierdie siekte veroorsaak. Ons kan nie toelaat dat die land verder besmet word met die onvermoë van die ANC nie. Daarom, agbare voorsitter, ter wille van Suid-Afrikaners se welstand, sal ons in 2024 moet ontslaa raak vir die ANC as die regerende party. Dankie.
Thank you. The next speaker is Honorable Christian. Honorable Christian.
Honorable House Chairperson, honorable members, honorable Minister, good day. It is an undeniable truth that the National Department of Health has, in many ways, failed to provide adequate healthcare services to the people of South Africa. This failure continues to have severe consequences on the lives and well-being of our fellow citizens. The persistent challenges surrounding the appointment and retention of healthcare professionals raises serious concerns about the accessibility and quality of healthcare services in our country. Insufficient resources have resulted in compromised healthcare services, inadequate infrastructure, and a shortage of essential medical supplies. The conditional grants, through which 85%, as the Minister alluded to, of the National Department of Health's budget is transferred to provinces, play a crucial role in supporting healthcare services on a local level. However, the nominal decrease in these grants compared to the previous year adds further strain to an already stretched healthcare system. The District Health Department, which receives the largest share, along with the tertiary services grants, are critical for ensuring the delivery of healthcare services at the grassroots level and supporting specialized care. The mismanagement of our healthcare system, driven by cadre deployment rather than merit-based appointments, has further exacerbated this crisis. Incompetent management practices hinder the efficient functioning of healthcare facilities and undermine delivery of quality care. The failures of our healthcare system are evident in various aspects. Firstly, the burden of communicable and non-communicable diseases continues to weigh heavily on our population. Despite the resources allocated to combating these diseases, we have not made sufficient progress in reducing their prevalence or minimizing the associated morbidity and mortality rates. It is disheartening to see our fellow citizens suffer unnecessarily due to the lack of effective disease management strategies and comprehensive preventative measures. In addition to the numerous challenges plaguing our healthcare system, we must address the critical issue of backlogs in cancer and obstetric surgeries, particularly in provinces such as the Northern Cape, where the Robert Mangaliso Sobukwe Hospital, the province's only tertiary facility, operates, and backlogs in obstetrics alone have reached 300 and counting. The growing backlog of these life-saving surgeries in provinces is a grave concern that demands immediate attention and concerted efforts to rectify the situation. This backlog places the lives of cancer patients at serious risk and compromises their life expectancy. It is unconscionable that individuals in need of urgent care are forced to wait for unacceptable periods. We must prioritize and expedite cancer treatment to ensure that every patient receives timely and effective care. Despite the largest share of the budget being allocated to Program 3, specifically targeting communicable and non-communicable diseases, we must acknowledge that allocation alone does not guarantee provision of quality healthcare services. The shortage of healthcare professionals, particularly nurses and doctors, poses a significant barrier to delivering comprehensive care. Furthermore, our health infrastructure is in dire need of attention and investment, as the majority of health facilities across the country do not meet compliance standards. Dilapidated hospitals, overcrowded and rundown clinics, and inadequate resources severely hamper our healthcare delivery. Patients are often left waiting for extended periods, and critical services are delayed or inaccessible due to infrastructure deficiencies. In addition to these systemic failures, we cannot ignore the issues of poor administration, inconsistent program implementation, and the continued alarming rise in medical legal claims. Billions of rands have been spent on these cases, diverting crucial resources away from providing care to the poor and the vulnerable. In the Northern Cape alone, these claims amount to 320 million rand. These challenges not only strain our already limited resources, but also erode public trust in the healthcare system. While we must address medical negligence and ensure justice for those affected, we must explore strategies to minimize these costs without compromising the rights of victims. Honourable members, it is clear that our healthcare system is in dire straits. The litany of challenges, from lack of funding to poor management, from corruption to inadequate infrastructure, demands attention and action. Government must allocate the necessary resources to address these issues, improve the staff to patient ratio, attract and retain professional skills, and eradicate corruption from our healthcare institutions. The constitutional right to emergency healthcare should never be denied. It is enshrined in our constitution that no one should be refused medical treatment. Our citizens deserve nothing less than a healthcare system that is accessible, equitable, and capable of delivering the highest standard of care. And this ANC government is unable to provide this care to South Africans. In conclusion, it is now the opportune time for the ANC to relinquish control and grant the Democratic Alliance the opportunity to lead, as the DA has consistently demonstrated a commitment to accountability, effective service delivery, and genuine concern for the well-being of the people of South Africa. Thank you, House Chairperson.
Thank you. I'll now invite the Mpumalanga MEC of Health, Honorable Manzini.
Thank you very much, Honorable Chairperson of the NCOP, the Minister and the Deputy Minister of Health, other presiding officers, permanent delegate to the NCOP, fellow ministers of health, and Chairperson. The Honorable Minister has already spoken on the importance of this day in the life of our nation and in the struggle of building a democratic society where all have access to quality healthcare irrespective of their position in the wealth ladder. And I will also fulfill my executing my duties if I do not remind South African of Madiba's view on healthcare. And that is why I begin by contributing to this important debate by recalling what President Mandela, who was inaugurated, of course, as indicated by the minister, and he said, health cannot be a question of income. It is a fundamental human right, close quote. That is why we must never stop the struggle for universal health coverage of this high level. Our Honorable Minister further celebrated this day. We must never forget what Nelson Mandela was nominated by Mama Albertina Sisulu, who was a nurse for a better part of her life. So health care workers are part of the history and significance of this day. In celebrating this important day in the history of our struggle in honor of President Mandela, we should work tirelessly to change the distorted distribution of resources in South Africa healthcare system. We cannot achieve Madiba's dream of not making access to healthcare a question of income if we remain with the unfortunate reality revealed by Oxfam in 2022 that a carrier and responsible of providing healthcare for more than 40 million people who are uninsured, which constitute approximately 84% of the national population, while the remaining 70% of doctors who work full-time are only responsible for providing healthcare to approximately 8 million people who are constitute 16% of South Africa population in the private sector. In remembrance of Madiba, we should expedite the implementation of the National Health Insurance, which will see us achieve social justice in healthcare within a generation. Honorable Dutuli, it is important to speak on issues informed by concrete reality and not myth superstition of head mentality. If you continue to advise irrational argument like you are doing today, will start believing that you are suffering from cognizance dissonance and very dangerous disease, which makes people not accept reality if it does not come from their own. To save you from yourself, I invite you to come witness the profound impact of NHI on the public healthcare in Gersiband. You will witness for yourself and get feedback from patients who have witnessed the great work of the National Department of Health in terms of the NHI pilot district. Through NHI intervention, the department has built a state-of-the-art clinics in Vuguzake, Tlazache, Balfo, among many others. Honourable Minister, we are hoping to be with you when you open a class facility Balfo soon, countries that we are going to open. And we are hoping that as you come there, they will also come also as member of the NCOP to witness what we are doing. In terms of other countries like your Botswana, Ghana, Rwanda, that have already ahead of us in terms of implementing the NHI model, there is absolutely no reason why South Africa is lagging behind in implementing this important instrument of universal access to quality healthcare. While we remain encouraged by the minister, optimistic that despite the challenges, we are still progressing towards Madiba's vision, we should also express our concern on the perpetual budget cuts in the sector as they constrain our ability to execute our mandate. According to the minister, our public health sector is underfunded by a minimum of 11 billion. And in my view, this is a recipe for disaster as the people of the province healthcare to continue to increase outside of our planned growth projection. We should collectively continue to lobby National Treasury to reprioritize funds in the country. And this is what we expect honorable members here to be assisting the Department of Health in terms of that. Chairperson, I stand in front of you today on behalf of more than 4.4 people of Mpumalanga to support the budget speech delivered by Honorable Minister Joe Phatla, who, like true revolutionary, did not hide anything from the people of South Africa and not did mask any difficulties. Mistake tell no lies, easy victories as correctly indicated by Amilcar Cabral. So whatever that you're saying, the minister acknowledged on behalf of all of us to say these are the challenges and this is what we are doing in terms of making sure that quality care services is provided to our people. The budget vote speech did not demonstrate our government's commitment to universal access to quality health care, but gave a true reflection of the state of public health care in South Africa and the intervention government is implementing to improve access and quality to health care in South Africa. It was not fiction or figment in everyone's head, which many of were spoken here have rejected the budget vote, would love a minister to present. The minister's budget vote demonstrated without any doubt that our government is committed to achieving the health target outlined in the NDP and improving the patient experience by means of complying with national cost standards such as upholding patients' rights and also OHS compliant. The Department of Health welcomed the pronouncement by the minister to continue supporting provinces like Limpopo and Mpumalanga in terms of building tertiary services such as oncology in order to reduce long distance referrals and improve our patient experience. Honorable Minister, we call upon the National Department of Health to increase Mpumalanga's share as we have indicated 14 billion allocated to our tertiary services. If there's any person that is saying tertiary services are not there, you must come to our provinces with the limited resources that we're having. We're not complaining, but we're making sure that we deal with our backlog. We invite other specialists to come to different provinces and make sure that services are given to our people. And also we'll continue to make sure, Honorable Barra, as South Africans, we are not getting tired of mantra which not backed by any scientific evidence that the DA government better
Order, members.
when they are governing. It is figment which only exists in the head of people who subscribe to racial supremacy. Let me start by commending the minister for hosting a successful mental health summit earlier in the year to give focus to the rising cases of mental health in our province. And the people of the province, they've seen Honorable Minister addressing with key stakeholders. Honorable Barra.
Order, members. Now we know you are Honorable Baka. We've concluded that.
Okay.
Order. Let us not drown the speaker at the floor, please. Please.
Yeah.
Please.
Thank you for correcting me. Honorable Baka, as in Mpumalanga province, we are working tirelessly to improve access to health care for mental health patients. And we have recently completed renovation of mental health care in ML Hospital, and we are going to renovate another 60-bed mental health in Kwamhlan. Honorable Chair, considering that we are the only province without a mental health hospital, we are hopeful that we'll receive the necessary support from the organ of state to achieve the target that we have put for ourselves. If this is not a progress towards universal health coverage. I then request those rejecting your budget vote to teach the globe of their new definition of this concept. Despite the difficulties, we are on track, Minister. Chairperson, it was President Fidel Castro who taught us that the importance of health workers as we build the world-class Cuban health system. In a graduation of health workers 2005, he strongly argued, open quotes, human capital is worth far more than the financial capital. Human capital involves not only knowledge, but also it is essential, conscious ethics, solidarity, truly human feeling, spirit and sacrifice, heroism, and the ability to make a little go a long way, close quote. The minister has internalized the lesson from one of the greatest human beings to ever live, Comrade Fidel Castro, and continues to prioritize health workers and their needs despite the adverse impact of budget cuts. The minister appreciated that health workers are our greatest asset of pride. They work under challenging conditions, and we have an obligation to make them feel appreciated. And that is why the Department of Health is in engagement with Samatu to find a lasting solution to doctors who could not be placed. And there is almost 8 billion reserved for training specialists in HR grant. Mpumalanga province deeply values its healthcare workers in all levels, and we believe they are very central in improving the patient experience. Over the past few years, the province has been recording a steady increase in the number of ideal clinics in the province, and we believe health workers are at the center of this improvement. We have improved from 53 to 59%, which represent 170 ideal clinics out of 292 clinics in the province. The quality of healthcare we provide in clinics is very important, and data available suggests that majority of South Africans visit their clinics more frequently than any other healthcare facilities. And also, as the province wants to welcome that we remain committed to our Marble Conference resolution and the strategy to bring the end of HIV by 2030. And Honorable Minister, we are encouraged by your recognition that Etlantsheni, as one of the 6 districts in the country, have achieved our 1990 target. Chairperson, if time permitted, I will continue as far as longer in explaining why this budget should be supported. But for the purpose of today's engagement, I'll stop here. Allow me to remind everyone, especially those who are opposing this budget vote, that the provision of quality healthcare service is about the restoration of human dignity, and it cannot be something used to gain undue political mileage. Beyond it being a constitutional obligation, it is a revolutionary and moral duty. Quality healthcare helps in defeat poverty and inequality, and it reaffirms and trumps that all lives are equal at worth. Good health sustain life and human civilization itself. The nation with better health outcome have a better quality of life, higher levels of provision, economic growth and creativity. We dare not fade in our noble mission of universal health access of quality health care. Honourable Minister, do not be deterred by critics as you leave these members to implement the noble plans contained in your 2023-24 budget vote. Remember these wise words from Roosevelt when he said, open quote, "It is not the critics who counts, nor the man who points out how the strong men stumble, or where the doer for this could have done them better. The credit belongs to the man who's actually in the arena, whose face is made by dust and sweat and blood, who strive valiantly, who comes short again and again," and close quote. The issue of your cadre deployment, I don't know where does it apply, because I've never seen anyone going to any of our hospitals saying this
As you
person is not
conclude.
qualified or this place not qualified, but you always come here and scream, maybe it's the notes that you're given that you must always criticize in terms of cadre. It does not apply. Those people, everyone meet the requirements in terms of the advert. I know you, if we had something, then just loud hail here and make noise, we'll go specific and say, Dr. So-and-so, nurse so-and-so, they are all registered, they've taken an oath, they qualified. Hence, we are able to stand here and say, this is the service that we are providing as a national department, as an ANC-led government, led by the capable Dr. Pata there, with all of us as MEC, making sure that on a daily basis, we are able to deliver quality service to our people.
Thank you, MEC Manzini. The next speaker is Honorable Hatebe Pungan.
Thank you, Honorable Chairperson, Honorable Minister, Honorable Deputy Minister, Honorable members. During COVID-19 pandemic, South Africa came to the realization that our health system is simply insufficient, underdeveloped, and at risk of collapse. 71% of South Africans rely on the state for healthcare provision, while 27% of South Africans are able to afford the cost of private healthcare. This is clear indication of just how unequal our country is, which is further perpetuated by the fact that public funded healthcare is not allocated based on need, but rather by each province's relative share to the population. Institutional arrangements are continued by budgets as they follow the norms that are already in place, as opposed to the driving the much needed change. Therefore, the IFP believes that there needs to be a refocus of the public funded health system, especially with a focus on identifying the existing barriers to equitable access to medicine. The healthcare budget has not been adjusted to account for the rising demand for health services, as well as consumer price index inflation, which is projected at 4.9 in the 2023-2024 financial year. Overall, this indicates an oversight on the part of the government, as this equates to a real reduction in healthcare spending of 4.9%, which this crucial department cannot afford at the moment. The real reduction in healthcare spending can also have a significant impact on the funds that are available to acquire equipment at public hospitals. For example, some of the avoidable factors that led to the deaths of the 909 babies at the Chris Hani Polokwane Hospital over the last 3 years include inadequate infection control, limited neonatal ICU beds, and hypothermia. In KZN, a staggering 81.9% of households rely on public health service. In addition, the KZN Department of Health is experiencing a shortage of medical staff and the increasing size of population. The 2022-2023 APP shows that the number of professional nurses sits at 152.5 per 100,000. These figures clearly show that there are not nearly enough healthcare professionals to deal with healthcare demand in South Africa. In conclusion, Honorable Chairperson, the IFP once again calls for healthcare to be prioritized by this government. Mental health needs greater prioritization, and the overall condition of equipment at public hospitals need to be addressed if we are to truly fulfill Section 27 of the Constitution. The IFP supports the budget votes, Honorable Chairperson. I thank you.
Thank you, Honorable Hajebe. The next speaker is the Western Cape Chairperson of Health and Wellness, Honorable Pretorius.
Honorable Chairperson, Honorable Minister, Honorable Deputy Minister, Honorable members. Today, I stand here to represent the Western Cape. And there's a part of me that feels tremendous pride at that. I firmly believe that my province has shown what is possible when the undoubtable resilience, intelligence, ingenuity, and will of South Africans come to be united behind a government that puts their well-being before anything else. I believe that the very real service delivery gains we have made are something to be proud of. In recent weeks, I've been privileged to visit hospitals, clinics, and health facilities throughout our beautiful province. I've seen firsthand the amazing things that our frontline healthcare workers are doing to serve their communities, to heal the sick, and to ensure that the health of every single citizen we serve. Walking with them on this path is the Western Cape Department of Health and Wellness, which continuously finds innovative ways to stretch its resources and to do more for our people. The last year has seen this department clear the non-essential surgery backlogs that developed during the COVID lockdowns and place a renewed focus on mental health with the construction of new psychiatric units. The department has placed a strong emphasis on disease control. Thus, targeted universal testing initiatives against TB are planned for many communities. Earlier this year, this department launched an aggressive campaign to avert an epidemic of measles in the Western Cape. I'm pleased to say that this provincial department has now administered more than 500,000 measles vaccines to children under the age of 15. The Western Cape is also the only province that has embraced the benefits of new medical technologies. Based in Tygerberg and Groote Schuur hospitals, our 2 robotic surgical systems have completed almost 300 surgeries thus far. These systems are so precise that they are able to make smaller incisions and reduce tissue damage in the patient. Not only is this beneficial for patients who suffer less pain and the possibility of complication, but it also reduces recovery time. This in turn frees up beds in provincial hospitals, which allow more patients to be treated. This demonstrates our health department's ability to prioritize spending in order to get the best possible results for our patients. But while I stand here filled with pride at what we have done, my heart breaks at what we have not been able to do. Because the truth is, the DA-led Western Cape government is doing more than ever with less than ever. I think it's no exaggeration to say that all of us in the Western Cape want to do even more. We want to employ more doctors. We want to employ more nurses. We want to bring our services to more people. We want better, more complete stocks of life-saving medicines. We want to do more for those who suffer from mental illness and substance use disorders. Our people deserve better. Our doctors deserve better. Our nurses deserve better. Chairperson, it's clear from this budget that national government will not stand with us as we fight for a better standard of healthcare in the Western Cape and in South Africa. Our country's economic growth has been slowed almost to a standstill by the impact of the ANC's rolling blackouts. Decades of corruption have eroded the confidence of investors that once stimulated our economy. The simple reality is that the national government has driven our economy into the ground and has been forced to make cuts as a result of its own failures. Because of these failures, this year, the health of our people has been chosen as one of the many sacrifices. In the Western Cape, this year will see the national government withdraw funding for several key grants amounting to millions of rands. We will lose 12.3 million rand from the Human Resources and Training Grant. We will lose almost 70 million rand from the National Tertiary Services Grant and from the District Health Programs Grant, a vital and indispensable component of our response to TB, to HIV, and a multitude of other community health challenges. We will lose a devastating 219 million rand. It goes without saying that this withdrawal of significant amounts to key grants has the potential to have a devastating effect on the ground and in our communities. Honorable Chairperson, allow me to state the obvious. It does not have to be this way. In the 2021 financial year, Eskom reported irregular expenditure of 67.1 billion rands, which is enough to fund the Western Cape's entire provincial equity share with almost 10 billion left over. This is why my pride in the Western Cape's progress is tempered by the sobering knowledge of how much we could be doing for our people. Just imagine what could be done, Chairperson, if those in Pretoria who simply do their jobs as effectively as our ministers in the Western Cape. Amidst all of this, the Western Cape government quietly and unwaveringly continues to exceed its mandate. The Western Cape is not waiting for national government to fix the energy crisis. Already, this provincial government is installing more than 50 hybrid inverters at rural clinics with more than 70 more to be installed in the coming months. The truth is that money spent on the Western Cape's health sector represents one of the best investments that can be made in public health in South Africa. While health departments in other provinces are beset on all sides with corruption scandals, ours is the only one in South Africa to boast a clean audit. The reason for this ultimately comes down to an institutional culture of utter focus on the well-being of our citizens and the desire to ensure that every cent is spent for maximum impact. Honourable Chairperson, why does the Western Cape so often go above and beyond? Why does the DA-led Western Cape government insist on doing more than is required? The answer is twofold. Firstly, we in the Western Cape refuse to leave our people behind. We cannot surrender their wealth and well-being to load shedding. We cannot allow their lives to be compromised by the poor decision-making and outright thievery present at the national level. But this government also goes further because it knows it has no choice. Underfunded and under-resourced as it is, it relies on its ingenuity and innovation to deliver services to our citizens. With the cuts contained in this budget, it will have to do so more than ever. I thank you.
Thank you, Honorable Pretorius. Then, thank you. The next, thank you. The next speaker is the Northwest MEC of Health, Honorable Sambata, who's on the virtual platform. Honorable MEC.
Malibongwe.
You seem to be struggling. No. Yeah, it's not on the platform. Maybe it's a problem of connection. We'll go straight to Honorable Lond. It's also on the virtual platform. Honorable Lond.
Good afternoon, Honorable House Chair. I trust that I am audible and that for this 6-7 minutes that ESCOM will not interrupt. Honorable House Chair, Honorable Ministers and Honorable Members, I'm going to start the sweep by using the quote that the Honorable messed up, and I want to frame it correctly in the South African context. The quote she used is, "Until the lions have their historians, tales of the hunt will always glorify the hunter." The proverb means that history is often written by those in power, and so it tends to portray them in a positive light. Even those who are not in power are not also able to tell their own stories and share their perspectives. Then the dominant narrative will continue to present a biased view of events that favors those in power. The proverb used the metaphor of a hunt to illustrate this idea, suggesting that the hunter is celebrated in the story even though the lion was the one who suffered. Honorable Meth, you and your cadres are the hunters. You only care and look out for yourselves and will take whatever trophy you can to enrich yourselves with scant disregard for how you affect the pride which is the South African people. Yet the tale you tell of yourself is saving when you are killing. When you are born in South Africa, generally you cannot rely on government to provide you a clean, healthy environment, since resources for our health sector were stolen by the hunters at Luthuli House, if not by themselves, by their sons and their daughters, or friends of those in Luthuli House. Yet the tale of yourself saving is the one you tell when in fact you are killing. When you grow up in South Africa, by the time you are 12, there is an 80% chance you cannot read or write with comprehension. That further keeps the pride suppressed and allow the uncaring ANC hunters to abuse their access to power. Yet you continue to tell a tale of yourself of saving when you are in fact killing. When you live in this country, the ANC hunters, through their policies and action, force the majority of the youth to be unemployed and vulnerable, making them dependent on handouts instead of fending for themselves in an open market economy. Yet you continue to tell a tale of yourself saving when you're in fact killing. These bloodthirsty ANC hunters only care for the citizens when they are at risk. In reality, this happens at the polls. Then suddenly promises are made and some efforts are put in to improve some services, plastering over the cracks created through years of not being accountable. Accountability starts when party members stand up against mediocrity and corruption, even within their own party. If you are a councillor and you protect the corrupt mayor, you should be ashamed. If you are a speaker and you continue to protect a corrupt mayor for years, you should be ashamed. If you are a member of parliament that serve in this house and you continue to protect incompetent and corrupt ministers, you should be ashamed. We are facing a crisis as South Africa. This can be seen in every aspect of our lives, from a failing health system in 8 of the 9 provinces to an energy grid that is teetering on collapse, to a deaf and dumb hunter corps that must be removed to effect real change. Honorable Lutuli of the EFF, there is one thing I wholeheartedly agree with you, and that is to remove the corrupt ANC from government. However, the truly sad thing is, however, that parties like the EFF, like Good, and like the Patriotic Alliance, then go back and vote to keep this very same ANC in power. You then join the hunters to feed on the corpse of the leftovers after they've taken their spoil. The only true solution is to vote for the DA, who has a proven track record in service delivery. Only then will a true workable alternative be delivered that will save our country and start the road to recovery for our beautiful nation. I thank you.
Thank you. Thank you. The next speaker is Honorable Ntube.
Thank you very much, House Chairperson. Let me also extend greetings to the Minister of Health and Deputy Minister, the Chairperson of the Council and the Deputy Chairperson respectively, and members. Chair, I didn't know that the DA and the EFF were in the same mixture, Chair. The last time I checked, Chair, is that the DA has declared the EFF as the enemy, but seemingly now they're in the same WhatsApp group. But maybe Mark Julius must know that Lutuli is working with Lloyd. Thank you very much, Chair, and say that the responsibility
Sorry,
of the...
Ntube. Honorable members, heckling is allowed, but drowning the speaker at the podium is not allowed. Please, let's have order and the decorum of the House. Honorable Ntube is protected.
Thank you very much, House Chair. House Chair, the responsibility of the opposition in South Africa is to bring no alternative at all. That responsibility is to oppose everything that the ANC brings to the table, Chair. That is why you hear Honorable Lutuli saying that our hospitals or healthcare facilities are being turned as a killing spree, which is not true. You've got people who went to our healthcare facilities who are healed today. You've got moms who gave birth there. You've got people who have been performed the surgical, and today we can attest to that. And we wish to say that the healthcare facilities are not the killing spree, but a facilities that are sensitive and should be given such a sensitivity as much as we deal with. Like it was 29 years ago, House Chairperson, beamed with hope, beamed with hope.
Honorable Chair, may I ask a question?
Sorry, Honorable Ntube. Honorable Lont, why are you disturbing?
No,
Honorable
Chair, it's not disturbing. It's asking if I may ask a question. That's part of the House rules, Chair.
Okay, let me ascertain whether Honorable Nsube, you are ready to take a question?
No, Chair, I'm
Honourable
not
member, Can
able
you
to
leave
take
that
a
to Honorable
question.
Nsube? Honorable Nsube, are you ready to take a question?
No, Chair, we are here to proceed with the budget vote.
It's not ready to take a question. Order, continue, Honorable Nsube.
Thanks, Chair. Like I indicated, like it was 29 years back when President Mandela ascended to the Union buildings with hope, great enthusiasm. Today, Honorable Minister, you presented a budget vote with the same hope, enthusiasm, and hope for our people. And it must be accepted with the same energy and hope. Every year on the 12th of May, the global health community observed the International Nurses Day, a significant day in the global health calendar. There is no question that nurses are essential to achieving the Sustainable Development Goals as the largest healthcare profession in the world. Throughout their lives, many people may only have access to nurses as a medical expert. As a result, nurses are frequently the most creative and ingenious in the approach to undeserved and unprivileged groups. The ANC has placed the health as a critical priority of service provision as enshrined in the Constitution of the Republic of South Africa. Without quality healthcare, the development of the country can be hampered. In the recent past, it is indeed through the context of COVID-19 pandemic that significance of nurses in particular was notable, this specifically as they were in many ways at the cold face of the COVID-19 response. It is therefore critical that in our engagement with the policy debate, we locate the importance of the human resource in health. Also importantly, being able to critically reflect on the importance of prioritizing a well-being of healthcare workers within the public health system. The strategic approach that underscores the human resource for health strategy 2030, it is that there should be a concerted effort to deal with matters related to healthcare worker absorption, retention, and capacitation in such a way that there are notable benefits on how to strengthen the healthcare system, prioritizing, among other things, development of a health. In order to do this, House Chair, it is also necessary to take in consideration some of the current challenges that affect the healthcare workers across the country. This includes, but not limited, mental illness among care workers in general, the current state of health profession and the challenges therein, the reality of the public health that is overwhelmed, as well as the status quo that enables the two-tier system that is largely inequitable and no longer fit for purpose for the transformation of endangering equality. Being mindful of this, some of the considerable intervention that must be made should include that as part of the healthcare worker wellness, the Department of Health, in particular provincial departments, should make sure that strategic policy formulation and implementation level, the commitment of creating an environment where inadequate support is offered to those who need it is upheld. It is important, Chair, of dealing with this, responding to the challenges that exist, being the prioritizing of development research that interacts within qualitative experience of healthcare workers in general, and their role in health system in particular. This is an important agenda item of our journey transforming the healthcare as a whole. Prioritizing such research, also being cognizant of the developments and shifts that are taking place in the higher education landscape in the country more general. The essence of being embedded in how impact can be measured in the kind of research that are being undertaken. Our research must not be a research for the sake of it, but must adequately respond to the policy gaps and implementation gaps that exist in the health sector. In order to achieve the best health outcomes, the basic requirements are right mix of health workers in the right place at the right time with the right resources to perform their jobs. Over and above, healthcare policy must include consideration of the extent to which the nexus between the rapid urbanization, increased migration, and climate change impact on the Department of Health, especially at the facility levels across the 9 provinces with the quadruple burden of diseases, global epidemic, that is mental illness, and other global challenges confronting the health sector, as the earlier alluded by the previous speaker that spoke here, Chair. The role of the healthcare workers in achieving a sustainable goals cannot be undermined. As seen through the budget vote, emphasis should still be placed on the required education training needed. The interventions that continue to be made through entities such as SAMRC and programs such as Nelson Mandela Fidel Castro Medical Training Program in Cuba. Another critical area which requires attention in building health human resource capacity, it is the training component. Chairperson, this requires higher education institutions to expand their training capacity. Many universities in South Africa have increased their health practices training programs, but this is an area which requires a continuous development, as it requires transformation, particularly in formally white institutions which do not have equitable access to historically disadvantaged persons. We should also employ higher education institutions to infuse governance and financial management skills in Bachelor of Medicine and Bachelor of Surgery. This is important because many of doctors who join the public health system develop into managers, and such management and financial skills are critical in the health sector. Our health institutions are led by health professionals, and they too should be capacitated to manage these facilities. Nursing colleges are also critical pillar in developing health capacity in the nation. We need to develop more programs to build capacity of community health workers to effectively provide support to health patients to promote various health provisions. Honorable House Chair, the ANC needs a 55th National Conference has resolved on a specific focuses as it relates to women health. It knows the health of mothers and the children as the key achieving development and equity. South Africa is set not to be on track to meet the 3 interrelated Millennium Development Goals concerning women as set out by other members of the United Nations. We still have time. Women's health, including universal access to reproductive health services as human right and a choice of termination of pregnancy must be prioritized in all public and private healthcare facilities. Focus on women's health must include the psychological effects of miscarriage. Mental health should continue to be a priority as this impacts many youth and others who are confronted by various challenges. As the ANC chairperson, we are of the position that the school curriculum must be reformed to avail mandatory programs of mental health. Statistics of males who commit suicide is high, and this speaks to the level of mental health. As argued by previous speakers, Honorable House Chair, there is indeed a synergy in terms of the return of investment on research and development from both human resources at the clinical level. It is therefore this synergy that will inform how the public health sector can ensure that there are improvements in both quality of healthcare and patient outcome. Similarly, this thinking must be anchored on the premise that the achieving universal coverage is indeed the best way to transform the health sector, and that it is rested on the successful finalization of the National Health Insurance Bill, that health equity will be achieved in South Africa in our lifetime, Chairperson. We just wish, Chair, to take to the Minister that we know of the developments that are happening in terms of the load shedding, Chair. We wish to say that to the minister that he should engage his colleagues in the cabinet that all the healthcare facilities must be exempted from the load shedding and water shedding, Chair, because without this, we are seeing many problems in our clinics and hospitals. Chairperson, we must upgrade the clinics and hospitals to be able to be compatible and respond to the needs of our people, Chair. In particular, Minister, there's a hospital in Manapo Moped in Kwakwa, which needs a serious attention. There's a Pilinomi in Bloemfontein, and there's an Butabel hospital, which needs a serious intervention of the national government. Chairperson, while we know the achievement we have made so far, we appreciate that more must be done, Chairperson. And then having said this, Chair, we wish to appreciate and then give a round of applause to the Department of Health for succinctly dealing with the COVID-19 the way they did, Chairperson. And we say that, Chair, that we think and hope that the same efforts and energy must be directed to cancer, AIDS, and all other diseases that we have. And say, Chair, that we must expedite the state capacity to have a state research and a vaccination hub that will respond to the existing diseases and those that are yet to come, Chair. For us not to be able to always, when the diseases, to give our money to private capital. The state must have a expanded state-owned capacity so that we are able to respond to the needs of our people. In conclusion, Chairperson, with the records, with the number of the records of strides we have made as the African National Congress and the introduction of the NHI bill, which is supported by many of us, Chairperson, unlike the DA, Chairperson, that wants to give the healthcare responsibility to the private capital so that one person can benefit over the other. And the EFF that is always daydreaming, Chairperson. We have, Chairperson, won the heart and the minds of our people, Chair, over the stride that we have made ever since we took power, Chairperson. That is why, Chairperson, next year our people will give the ANC 2/3 majority for them to be able to continue with the program of a National Democratic Revolution. Thank you very much, Chair.
Thank you. Thank you. The next speaker, order members. The next speaker is the Honorable Minister of Health, Honorable Dr. Pasha.
Thank you very much, Honorable Chairperson. Let me thank all the honorable members for their spirited participation in this budget vote, including, of course, those with a very narrow focus, parochial focus, and understanding of South Africa. Let me just remind the honorable members from the DA that they must make peace with the fact that South Africa is a unitary state. There is no state called the Western Cape. Until such time that they can make peace with that, they're going to be out of line every time they speak. And it looks like they all suffer from the same illness. Once something is written from their masters, even when we deal with the issue, they can't actually acknowledge and say that this is a progress which we're making as a sector and also as a country. So we have 9 provinces, 52 districts, and over 300 municipalities, which constitute the Republic of South Africa. There is no Republic of the Western Cape. Now, I want to say, I'm quite grateful for the fact that, notwithstanding this narrow view of the DA leadership, within the health sector, including the MEC from this province, sometimes she gets lost, sometimes when they've given her some particular notes, but overall, as a health professional, I find that, from time to time, she remembers that she's part and parcel of a team. And we work fairly well together in focusing on improving the quality of health services for all South Africans. So there is not going to be, you see, people travel from throughout the whole of the country and even beyond South Africa. So as we improve our services, we're looking at it as a national service, acknowledging the fact that somebody who might ordinarily live in Cape Town tomorrow will be getting a job in Johannesburg, in Durban, in other places. So our focus as a team is to make sure that we improve quality of service for the whole country. So I want the honorable members to, Pretorius, to disabuse himself and his party from an approach which suggests that when there is a challenge in terms of funds and revenue allocation, as if, he points out, oh, the Western Cape will reduce this, as if there is a particular target to reduce the allocation for the Western Cape specifically. When we work on the basis of a national fiscus, and that's how we get allocated. And when there are particular challenges, we request for particular funding, and Treasury, we allocate according to what is available. We always lobby, and I can tell you, honorable members, that right from the top, from the president, we have who's got a very soft spot in as far as health services is concerned. The Minister of Health, of Finance himself, also very supportive, but they have to work within the fiscus which is available, and we always try to push the boundaries in terms of more allocation. But I can assure you that from the political leadership, nationally, from the colleagues, I'm sure all of you have seen, even the colleagues who have been on virtual, that we do have a very committed, very spirited and committed, team of political leaders. And I can assure you that also at the administrative level, led by our DG and the team who are seated here, that what we need, honorable members, is your support. We do have challenges, there are many, but I can assure you that the fact that we have, even though there was a serious impact of the COVID-19, the fact that we emerged out of that without a collapse of the system, notwithstanding all the pressure, what it says to us, and the message to us, is that even the bigger project of making sure that we can improve the quality of services is doable. And I want to leave you with the request again to say, when the NHI bill finally goes through the National Assembly and comes the side of the NCOP, please support it, because it can only be for the good of all South Africans. I hope that even the DA members will not go according to the script, but will use their own conscience. They always talk about conscience. Please use your conscience when the NHI bill comes to the NCOP, because it's for you, it's for your children and your grandchildren. Thank you very much.
Thank you. Thank you. Thank you. Honorable delegates, that concludes the debate and the business of the day. I would like to thank Minister Dr. Phahla, Deputy Minister Dr. Dlomo, permanent delegates, MECs from our respective provinces that we represent in the NCOP, all special delegates for availing themselves for this sitting. The House is adjourned.
Thank you, Papa.